for the Health Information Technology program here at Seminole State College of Florida. And so I'm going to talk a little bit about a career in health information management, better known as HIM. So first we need to define what is health information. So it's all information that could be gathered when being seen in a doctor's office or other healthcare facility. So it's related to a person's medical history, including symptoms, diagnosis, procedures, and outcomes. Health information records include patient histories, lab results, x-rays, clinical information, and notes. A patient's health information can be viewed individually to see how a patient has changed, and it can also be viewed as part of a larger data set to understand how a population's health has changed and how medical interventions can change health outcomes. So now that we know what is health information, what is health information management then? So health information management is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. It's a combination of business science and information technology. Now, health information professionals are experts in caring for patients by caring for their medical data. So I always say we're the caregivers of the patients on the non-clinical side. So it's nothing worse than, coming out of the hospital, having been hospitalized for several days, and then a week later you get a bill in the mail, this astronomical bill in the mail that might as well send you right back to the hospital because you had a heart attack, looking at how much you owe the hospital, right? So we ensure patients' health information and records are complete, accurate, and protected, which helps to ensure that your bill is accurate and correct. We implement and optimize computer information systems. We code diagnosis and procedures in all care settings. We maintain patient confidentiality. We collect and store information, and then we use and transmit the information. So there are endless opportunities for employment in HIM. So you can be a director or manager of HIM, an electronic health record trainer, a healthcare data analyst, a clinical coding analyst or a clinical coding professional, as well as a billing professional. You can also be a cancer registrar, which works with collecting data related to related to cancer patients. You can be a data analyst. You can be a credentialing specialist who work to make sure that the physicians that work for the hospitals or who are able to treat patients at the hospitals have their necessary credentials, essentially. You can be a personal health record manager or advocator, an electronic health record implementation analyst, a privacy and security manager and officer, and you can also work at insurance companies. We have graduates working for a Progressive insurance company as coders, and as well as Cigna, and we have the Hartford Apprenticeship Program, in which we have students and graduates working as disability claims analysts. So an HIM career is right for you if you see yourself in a career that offers diverse opportunities. You want to work in healthcare, but not directly with patients. You have an aptitude for science, but also like management, law, and computers. And you enjoy working with professionals such as your physicians, administrators, executives. And you want a career where you can choose to work on your own, with others, or some of both. So how did I become interested in a career in HIM? So I attended Florida A&M University, and I attended majoring in pharmacy. Well, my first semester in pharmacy, I did well. I did all the chemistry. I placed well the summer before on my chemistry exam, so I was able to take the the required chemistry courses, but the problem is I didn't like it. I didn't like what I was studying. I didn't want nothing to do with it. So I took a trip over to the Allied Health Sciences building, and I slowly was able to eliminate things I didn't want to do. So just like on the previous slide that said, you know, you want to work in healthcare, but not clinically, that's me. So nursing was out of the question, physical therapy was out of the question, occupational therapy was out of the question, respiratory therapy was out of the question. So anything dealing with bodily fluids or anybody not related to me breathing on me on a consistent basis was a no-go for me. And so I landed on health information management. And to be perfectly honest, it's been like the best decision I've ever made. It was a half-cocked decision when I look back at it, but it was a very good half-cocked and risk-taking decision. I always say, you know, you need to be able to bet on yourself, because if you won't bet on yourself, then you can't expect anybody else to. So for me, I'm one of those, I'll bet all the money that I have down to the very last penny on myself. And I think everyone should look at themselves the same way. So HIM deals with a lot of current health issues, and one of those health issues is patient identification. So the ECRI Institute defines patient identification as a process of correctly matching a patient to appropriately intended interventions and communicating information about the patient's identity accurately and reliably throughout the continuum of care. So accurate patient identifications offers many benefits, such as improve patient safety and outcomes, improve patient satisfaction, reduction in duplicate testing, reduce delays in claims, billing, and denials. So for an example, I used to work for Orlando Health, and I went to see one of the doctors there, a cardiologist or whatever. So saw them, everything is fine, but I never received the bill. But then I get a call from the collections agency like, hey, your account is now in collection. And you want to know why I never received the bill? Because they had my address wrong. Somehow they transposed the numbers, so I never received the bill to pay my bill. So, you know, that was something that I had to sort out with the facility, and they had to bring the account back from collection so that I could pay it and all that other good stuff. So that's just one, like I said, that's just one instance of the patient identification issue. Also, you have things where you have patients with the same name or identity theft. There's a lot of that happens nowadays. One person may not have medical insurance, so they might steal somebody's medical identity to get procedures done that they need done, and then they don't get the bill. The person's that medical identity that they stole actually gets hit with the bill. So here are a couple real life examples of patient identification mix-ups. So patient presents for an emergency appendectomy. The insurance provider denies the claim, citing prior removal of appendix. And after further evaluations, the patient brother had used his insurance card years prior when he needed the procedure. So again, medical identity theft. Another example is we had a lab test where the patient had a pap smear done, but had a male gender name. So the lab canceled the order thinking it was a mislabeling, when in fact, the female patient who had a pap smear did have a typically male gender name. So this could have really been bad, because let's say that the patient had some abnormal cells and maybe they were cancerous, and she doesn't know that she has this going into her body because her pap smear was canceled. So maybe that leads to her getting a late stage diagnosis of cervical cancer. Lastly, we have a patient that was scheduled with the wrong date of birth and address. When the patient registered, the date of birth was not verified. That again, that can lead to implications for billing and being able to be eligible for certain procedures. And then we have two patients with the same first and last name and the same dates of birth. The records were combined several times over the course of years. Patient safety was jeopardized as the two distinct patients could have been harmed due to the combining of their records. So for example, you have John Smith, born October 20th, 1984. John Smith A has diabetes and is insulin dependent. John Smith B has a do not resuscitate order. Because their records are now mixed up, it's possible for them to receive the incorrect treatments or services. So let's say John Smith B has a heart attack and goes into and flatlines, and they're looking at their records and they don't see that there's a DNR order, quote unquote, and so they bring him back, and now they're in violation of his DNR order because he didn't want to be brought back. Or, you know, John Smith gets John A's insulin, and that sends him into and that causes health issues for him. John A has issues now because he didn't get his insulin. So the patient identification mix-ups can have some serious consequences behind them. So now that I have hopefully gotten you jazzed up about the profession, are you excited to learn more? How does one go about getting started in pursuing a career in HIM? There are a couple of different options for those looking to get into the profession. So the first option is the associate degree, which makes you eligible for the Registered Health Information Technician exam. So it's a 2-year degree. Programs are on campus, online, or hybrid. So Seminole State College, we offer the 2-year degree that's online, but you do have a face-to-face internship. And we also have a coding certificate program, which is also online. The good thing about our program is that the classes you take to earn the coding certificate also count towards the 2-year degree. So the courses that are in the 2-year certificate are also part of the 2-year degree, basically. So my goal is to prepare graduates to be productive with minimal additional training following employment, and provide a pathway to high skill, high wage earning careers that offer long-term sustainability. So some of the courses you'll take in our 2-year degree program include medical terminology, anatomy and physiology, pharmacology, data analysis, healthcare statistics, quality management, coding courses in ICD-10 and CPT coding, legal aspects of HIM, human resources management, reimbursement methodologies, and health information systems. So how does someone advance in the HIM profession? So this snapshot is taken from the AHIMA's U.S. Salary Survey report of HIM professionals in 2019. And so the top 3 skill set elements that survey participants believe had the greatest influence on promotion was professional experience, education level, and certification level. Now, there are also other skill set and elements that factor in, such as success on projects, personal effort to affect change, luck, just simply being in the right place at the right time, and just knowing the right people. So we're going to focus on professional experience, education, and certification as far as advancing in the HIM profession. So with professional experience, you start at your entry-level roles, getting your foot in the door as a patient registrar or as an HIM analyst. And then you stay in those roles for like 6 years to a month, and you move into a mid-level role as a coding professional or as a health information technician, eventually moving into advanced level roles such as a coding trainer, management, supervisory roles, or a data analyst. Now, while you're climbing those professional level roles, you also want to take into consideration your education, your coding certificate, your associate degree, and most of all, you want to be a lifelong learner, okay? This is a profession where you're constantly learning, things are constantly changing, so it's important to stay up to date on the latest trends and issues within the HIM industry. And then as far as certifications, you want to focus on your Registered Health Information Technician, which you are eligible for upon completion of the associate degree. And then you have several coding certifications, such as the Certified Coding Associate, the Certified Coding Specialist, and then the Certified Coding Specialist Physician. And if you notice, each one is sort of like a rung to the next credential. So starting with the Certified Coding Associate, all you need is the completion of a coding certificate program. And guess what? We have that coding certificate program. So our coding certificate program, the education will make you eligible for will make you eligible to sit for the exam and give you the knowledge and skills needed to be successful on the exam. Next, you have the Certified Coding Certified Coding Specialist. All you need is the experience in education or certification. So having that CCA, as I talked about previously, would make you eligible the certification around. And then having your associate degree or your coding certificate, and then a year of experience will help you and make you eligible for sitting for the exam. And then you move up to the Certified Coding Specialist Physician. Again, for certification wise, that makes you eligible having your CCS. So as you see, each one builds upon the previous certification. So here's my contact information, and I also included the contact information for my advisor, Andrea Ulmer. And this concludes my presentation. So if you have any questions.
The Health Information Department manages the patient medical record in any format. Our mission is to ensure the patient record is completed accurately and timely so that the information is available to the care providers and the patient while still ensuring privacy and confidentiality. HIM staff begin the day scanning records that have come in overnight so that the care team has access to this information. Staff verify that required documentation for current inpatients such as history and physicals are available in the record as soon as possible so that they can be reviewed by the provider prior to the physician evaluating the newly admitted patients. We have several specific processes that HIM staff are responsible for monitoring and completing. We ensure provider documentation, including dictation, voice-to-text, and self-type notes, are professional and accurate so that they are available for ongoing patient care. Although we use an electronic health record, we still receive paper records, such as when a patient brings their personal medical records to us from an outside facility or an external test is completed. Release of information really means sharing the patient's health history with other caregivers involved in the patient's treatment. Records may be requested for a variety of reasons, in addition to direct patient care. For example, to support hospital charges billed, for payer and quality audits, and many other purposes. Coding is also a task that is completed in the HIM department. Codes are assigned to all patient diagnoses and procedures for patients treated here at the hospital. These codes are assigned based on the caregiver's documentation in the patient's medical record. They are used to support a patient's bill for services. HIM has changed so much in the past several years, as has healthcare in general. You see, we still have many paper files. We stopped adding to these files when we began using an electronic health record in 2010. At some point, these files will be transitioned in some way to an electronic format. Today, the records are all electronic with access granted based on user security. Health information can come from a variety of locations. Some records are still mailed to HIM. These records are then scanned into the patient's health record as correspondence. These are typically from the patient's distant care providers. Records can be uploaded to a secure portal by providers too. HIM staff verify the records are appropriate and then release these into the patient's Mary Greeley electronic health record. These records are then viewable by the patient's care team when the patient comes to the hospital for admission, a procedure, or other hospital services. Some areas that will continue to grow include privacy and security needs, and how that data is used requires information governance and management of the data. In the past, patients had to come to the HIM department to fill out a form so that we could mail their records to them or request records from outside facilities. Today, the patient can use a web-based portal to request their records. The records are released to a secure portal, and the patient can view or download the records on their computer in their home. On the other hand, there has to be a fine balance between protecting patient health records and allowing them to be available for continued patient care needs. While the nurses and other caregivers are doing their very important work of actually taking care of the patient, we are taking care of the paper, or today the electronic records.
Known as HIM. So first we need to define what is health information. So it's all information that could be gathered when being seen in a doctor's office or other healthcare facility. So it's related to a person's medical history, including symptoms, diagnosis, procedures, and outcomes. Health information records include patient histories, lab results, x-rays, clinical information, and notes. A patient's health information can be viewed individually to see how a patient has changed, and it can also be viewed as part of a larger data set to understand how a population's health has changed and how medical interventions can change health outcomes. So now that we know what is health information, what is health information management then? So health information management is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. It's a combination of business science and information technology. Now, health information professionals are experts in caring for patients by caring for their medical data. So I always say we're the caregivers of the patients on the non-clinical side. So it's nothing worse than, coming out of the hospital, having been hospitalized for several days, and then a week later you get a bill in the mail, this astronomical bill in the mail that might as well send you right back to the hospital because you had a heart attack, looking at how much you owe the hospital, right? So we ensure patients' health information and records are complete, accurate, and protected, which helps to ensure that your bill is accurate and correct. We implement and optimize computer information systems. We code diagnosis and procedures in all care settings. We maintain patient confidentiality. We collect and store information, and then we use and transmit the information. So there are endless opportunities for employment in HIM. So you can be a director.
Hello, good morning. Let me welcome you to day 8 of the first scientific conference of the University of Port Harcourt School of Public Health. Today is dedicated to health information management. So we have several distinguished personalities from that specialty. They have been invited, and thankfully, they are all present. So we start today. We will start the proceedings for today with the national item, followed by our university item. National item, please. Let's rise for the national item.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
The University of Port Harcourt item.
On the green lowlands and swampy plains of the New Calabar River stands the University of Port Harcourt, a citadel of learning and excellent education, a home of academic enthusiasts, searching for knowledge and wisdom, enlightenment and self-reliance on mission. Our hope in the future is rooted in God. The vision of our fathers shining in the stars, opportunities unlimited and equal. Our progeny citizens of the universe, from far and near, the pride of Uniport, because unique, Uniport, unique, Uniport, unique, Uniport,
Thank you. We can now resume our seats. Okay, so let's start with the etiquette. And after that, we'll take make one or two recognitions, then read out the agenda for today. Can we take the
Etiquette for participants at the first scientific conference of the University of Port Harcourt School of Public Health. Date: Monday 15th to Tuesday 30th September 2025. Venue: virtual. You are cordially welcome to the first scientific conference of the University of Port Harcourt School of Public Health. To ensure a smooth, distraction-free conference, please take note of the following guidelines. Before joining the conference, test your technology. Attend using a computer, not a phone, to reduce distractions from calls. Make sure your device can handle Zoom. Ensure a stable internet connection, preferably use Wi-Fi or internet modem. Avoid relying solely on your phone. Check that your microphone and camera are functioning properly. Prepare your space. Choose a quiet, well-lit room. Use a neutral or blurred background to minimize distractions. Dress appropriately. Wear professional attire just as you would for an on-site conference. Log in early. Use your full name when logging in. Join a few minutes before the 10 a.m. start time to resolve any technical issues beforehand. During the conference, keep your microphone muted unless you are speaking to avoid background noise. Stay focused. Give your full attention to the proceedings. Avoid multitasking. Video guidelines. Turn on your video to remain engaged in the conference. Turn off your video if it may be distracting to others. You would be required to turn on your video when speaking. Ensure your hair and background are appropriate. Use this hand feature to indicate you wish to speak and wait to be recognized. Use the chat feature for relevant comments, questions, or to signal contributions. General conduct. Be respectful. Maintain polite and professional language in all interactions. Maintain professionalism. Conduct yourself as you would in an in-person setting. Thank you for your cooperation and understanding.
Thank you very much. Let me go through the agenda for today's proceedings. I'm sure that a lot of us don't have the program, but so let me read it out. We have taken the national item and the University of Port Harcourt item. And we have taken the etiquette for participants. We'll soon do the special recognitions. Then after that, the welcome address by the director, which I'll be taking. Then after that, the chairman will make his speech. The chairman of today is Dr. Umar Farouk Abubakar, a registered health information management professional and associate professor of health information management. The next we'll take the speech from the special guest of honor, the registrar of the Health Records Officers Registration Board of Nigeria, Alhaji Babagana Mustafa. And then after that, we'll take goodwill messages from the president of the Association of Health Records and Information Management Practitioners of Nigeria. Then after that, we'll take the citation of the keynote speaker, and then we'll take the keynote lecture. Of course, the keynote speaker is Dr. Jacob Kainde Opele, Associate Professor of Health Information and Knowledge Management. Okay, then we will have a short interlude, a short cultural display before we go on to the second part of this morning section, and that will be the panel discussions. And then that will be starting around 12, and hopefully will run for about 1 hour. And we have scheduled 3 four discussants, Dr. Anthony Webom of the University State University, Port Harcourt, Dr. Sani Nasiru of the Nasarawa State University, Barrister Boniface Nwani, a former president of the Professional Association, and then we have Mrs. Halima Ahmed Haruna, the head education unit of the Health Records Officers Registration Board of Nigeria. So we'll have all these, at least for this, for the first part of today's program. Okay, so I will quickly establish the protocol. I'll and after that, I'll give the welcome address. Let me start with by recognizing the Vice Chancellor of our university, Professor Owunari Abraham Georgeville. He is the 9th Vice Chancellor of our university, a multi-award winner. Currently, he's unavoidably absent because he's one of the few personalities from Nigerian universities that are currently in New York attending the UNGAS. The special guest of the day, Alhaji Babagana Mustafa, the registrar of the Health Records Registration Board of Nigeria, Abuja. The chairman of the day, Dr. Umar Farouk Abubakar, Associate Professor of Health Information Management, Federal University of Health Sciences, Azare. The keynote speaker, Dr. Jacob Kainde Opele, Associate Professor of Health Information and Knowledge Management, Federal University, Oyo Ekiti. The Deputy Vice Chancellors of our university, there are 3 of them, Professor Chukwudi Onyanso, Professor Rosemary Ogu, and Professor Angela Van Briggs. They are hereby recognized. Members of the University of Port Harcourt Governing Council, I want to specially recognize Professor Kelechi Okonta, Professor of Cardiothoracic Surgery, and Professor Olufemi Martins Adesope, the multi-talented Professor of Agricultural Extension and Development Studies. The registrar of our university, Dr. Mrs. Gloria Chinda, and the other principal officers of our university. The acting provost of the College of Health Sciences, Professor Ngozi Ekeke, the dean of the graduate school, Professor Kinikanwa Anele, deans of other faculties. I want to especially recognize the dean of my faculty, Faculty of Clinical Sciences, Professor Macklin Akpa. I also want to recognize Professor Obunge, the dean of the Faculty of Applied Health Sciences, who will be speaking, who will be giving a short message in course of this program. And I want to also recognize Professor Father Walter Ihejirika, the Dean of the Faculty of Media and Communication Studies. Directors of institutes and centers. I want to especially recognize Professor Ogaji, the Center Director of the African Center of Excellence for Public Health and Toxicological Research. The panelists on the theme of the day, panel discussants on the theme of the day, and the theme of the day is postgraduate education in health information management. And we have Dr. Anthony Webom, biostatistician, registered health information management professional, and currently the HOD of Department of Public Health, Rivers State University, Port Harcourt. We also have as a discussant, as a panel discussant, Dr. Sani Nasiru, who is currently an associate professor of health information management with the Nasarawa State University. We also have barrister Boniface Wani, of course, a lawyer, and but also a registered health information management professional. He is the former national president of the Association of Health Records and Information Practitioners of Nigeria. The fourth on the list, but definitely not the least, Mrs. Halima Ahmed Haruna, Assistant Director and Head of the Education Development Unit of the Health Records Officers Registration Board of Nigeria. I want to recognize the distinguished guests, especially the officials of the Health Records Officers Registration Board of Nigeria, Abuja, the President and Executive of the Association of Health Records and Information Practitioners of Nigeria, members. I want to also specially recognize members of the what I have called the PG Implementation Committee of the Rivers State branch, Rivers State branch of the Association of Health Records and Information Practitioners of Nigeria, who worked tirelessly to see the commencement of the postgraduate programs in health information management in our school. Let me place on record their names. Dr. Ada Gayos was the chairman of the Rivers State branch at that time. Mr. Oguzere Maruche, Dr. Israel David Imarele, Mr. Wanro Aloysius, Mr. Shedrack Samuel Simeon, Dr. Ike Webom, Mr. Sani Kwega, Mr. Wosa Sevanos, and Mrs. Pauline Okocha, members of the implementation committee. I especially recognize them, especially for their efforts, in ensuring the commencement of our PG program in health information management. Professors, lecturers, and supervisors of the School of Public Health, I want to especially recognize my own deputy, Professor Charles Tobin West, the Deputy Director of the University of Port Harcourt School of Public Health, and a former acting CMD of our teaching hospital, the University of Port Harcourt Teaching Hospital. I want to also recognize the coordinators, lecturers, and supervisors in the Health Management Information Division of our school. These I'm going to mention them because they are very, very important to us. They are very, very important to us. Without them, we wouldn't have. It would have been difficult to run the program. Dr. Opele Jacob, Dr. Emeka Donatus Makata, Mr. Oguzere Maruche, Dr. Odwak Peters, Barrister Boniface Wani, Dr. Adebayo Temitayo, Dr. Umar Farouk Abubakar, Dr. Adio Razak Adetuna, Mr. Shedrack Samuel Simeon, Dr. Israel David, Dr. Tunde Ayelege, Dr. Macaulay Babafemi, Dr. Ayowe Terenes and Dr. Eze. I think I especially recognize them for the role they have played and they are still playing in running our program. We must say that we are completely dependent on them. Health information management is not like any other program in the School of Public Health that can be taught by anybody. There are specialized knowledge. It has a specialized knowledge that is known to only those that are trained in health information management, and we have them there. I want to also recognize members, lecturers in my department, that is the Department of Preventive and Social Medicine of our medical school, management and staff of the University of Port Harcourt School of Public Health, especially the admin secretary and the finance officer, colleagues, students of the University of Port Harcourt School of Public Health, ladies and gentlemen. So I have established a protocol, a long one, but it's necessary. It's necessary to recognize these distinguished persons who played and are still playing active role in establishing our PG program in our school, and of course those that will be contributing actively in today's deliberations. So I will just quickly take my opening address, and in doing so, I will quickly adopt the protocol I just established. So this is an welcome address delivered by the Director of the School of Public Health, Professor Best Odinoha, on the day dedicated to health information management at the first annual scientific conference of the School of Public Health. It is with great honor that I welcome you to the 8th of the first scientific conference of the University of Port Harcourt School of Public Health, the day dedicated to health information management. The University of Port Harcourt School of Public Health was established in January 2019 by the University of Port Harcourt, by the Senate of the University of Port Harcourt, as a semi-autonomous academic center to provide postgraduate education in public health and the allied health sciences. The semi-autonomy of the School of Public Health gives it the powers to set and collect fees, and then use the collected fees to run its academic programs, but subject to the rules and regulations of the university. This gives the school the wherewithal to recruit and pay ad hoc lecturers from within and outside the university and from the industry to lecture in its academic program. So I listed some of our lecturers, and they are all drawn from all over the country, And then I think we are also getting interest from practitioners abroad. And the good thing there is that some of them are interested in even providing their services pro bono. So it is because of these unique powers of our School of Public Health that we have been able to do that. So which means that this made it possible for us to recruit talents from all over the world to run our programs. So the University of Port Harcourt has been so successful. We have been so successful that we are now even finding it difficult to recruit, to get external examiners. We are finding it difficult to get external examiners as it is difficult to get external examiners because the rule is that the external examiner shouldn't have much contact with those with students he or she is examining. But it's a good problem to have. It's a good problem to have. But we are finding ways around it. So the school started with 4 academic programs, but currently runs 3 PGD programs, including PGD in Health Information Management. It runs our school runs a 10 master's program, including a master's degree in Health Information Management, and it runs a Doctor of Public Health. It has a Doctor of Public Health program, a professional doctorate, and PhD programs in all the subspecialties of public health and the allied health sciences, including a specific PhD program in health information management. Academic programs in our school are deliberately designed to be both academic and professional, to sharpen the research skills of students and prepare them for a career in academics while emphasizing the practical skills that are needed for professional work. So, which means we have the best, in this, we have the best curriculum, in that it's not just academic, but also the professional aspect. And this is very, very important for a profession, for a course that serves a profession like health information management. You have to not only teach the theory, but you should be able to teach the students how to apply the theory. The results of this have been very remarkable, as the graduates of our various programs, irrespective of their first degrees, have been able to secure employment from the health in the health sector few months after their graduation, and are known to even perform better than the others. The success of our graduates in the labor market and their achievements in their jobs can be attributed to our competency-based curriculum, expertly delivered by lecturers who are drawn from the academia, industry, and government. So the good thing is that our lecturers are not restricted to those that work in in universities. We also recruit lecturers from teaching hospitals, from NGOs, all over, because we use what we call the triple helix model. In the triple helix model, the principles as is the postgraduate programs in Nigeria, but also lay emphasis on the practice to ensure that the graduates of our program are still embedded. We lecture to their program of study, and these short courses are certificated separately. They are certificated separately. So at present, these short courses are developed from within, but we are looking at collaborators. We are looking at collaborators, and with this, we are calling, we can collaborate with the board, with health records officers registration board of Nigeria to host these short courses. We are also calling upon the association that we are ready to partner, and of course organizations like NCDC. We are also ready to partner with them to host this. I understand that health information management practitioners are expected to be very conversant with some softwares, especially the ones that are commonly used in healthcare delivery and in surveillance. We can actually create short courses to make sure that practitioners are trained on how to use those short courses, these softwares. And the good thing is that they are certificated. They are given proficiency certificates at the end, meaning that they can use it. They can use that certificate to back up their qualification. And that is what we have done so well, because students in the School of Public Health, they don't just graduate with their degrees or their diplomas, but they also go home. They also graduate with several of these proficiency certificates. So after this conference, we hope to continue the discussion with the board and the association and the NDDC and the other stakeholders to launch short courses that will be of benefit to holders, to health information management practitioners. Postgraduate education in health information management is the theme of the 8th of our scientific conference, the day dedicated to health information management. So a little bit of the history of the postgraduate program in our institution. It was instigated by the River State branch of the Association of Health Records and Information Management Practitioners of Nigeria, under the then leadership of Dr. Gaius Ada, and reinforced by the visit of the former president, Barrister Boniface Wani, to the University of Port Harcourt. And with that, we took off. So the school applied and received the approval of the academic board of our university to start the PGD and the PGD and the master's program in health information management. The PGD program we started because it removes the need for a first degree, and is designed to enable holders of the HND certificate from the School of Health Information Management to meet the admission criteria for admission into postgraduate programs, thus enabling them to break the salary level ceiling for HND holders and to attain the zenith of their career. So, but the Master of Science program in Health Information Management is, on the other hand, open to degree holders of first degree in Health Information Management and other related fields, or PGD in Health Information Management. Both programs commenced in the 2020-2021 academic section, and have so far graduated 4 sets of students, numbering more than 250. So we have more than 250 graduates from our various from our 2 programs. Our postgraduate programs in health information management, I must say, are pioneering. They are pioneering because they are both academic and professional, as I said earlier. And whereas the other programs, a lot of them are professional, such that they can't be used for postgraduate for further degrees. Okay, and the other good thing about our program is that it's hosted in the College of Health Sciences instead of the Department of Library Science and the Faculty of Education. I noticed that some of the programs were actually in library science and under the Faculty of Education, which means that they didn't have that relationship with the hospital, which I'm sure affects even the kind of lectures the kind of lectures and of course the kind of examples they give, because you have to be in the hospital to understand waiting time and its implications, understand filing, missing folder, etc. You need to be in the hospital. But if you are domiciled in the Faculty of Science, where perhaps lesson notes are emphasized, the students may not have that required training. So, but our program, I must say, our programs are, however, not without any problem. I have to state that. For example, the implementation committee, they recommended a lot of courses from the HND programs, and there were plenty. But we noticed that, of course, there were plenty, and we also noticed there were those the content of those courses were syndromic, and they were syndromic. Instead of teaching the students the deductive reasoning that is used in postgraduate education. So our attempt to consolidate these courses and make them modular, because in our program we run the modular, we have modular courses, which means if you want to teach a skill, you have to bring in everything about that skill and into that course. So when we did that, some of the members of the implementation committee were not happy. Especially because we also borrowed some courses from our other programs, epidemiology, biostatistics, demography, which we thought were relevant to the practice of health information management. They complained that there were too many, but yes, there were too many. That was what they complained of. So that created some problems from within. It created some problems from within. But the last straw that broke the relationship with some of the members was our decision to expunge biostatistics from the name of our PG program. When we started, it was health information management and biostatistics. But when we went to the graduate school to seek approval, the statistics department of our university insisted that before they will allow us to include statistics in the program, that they will have to introduce an additional course in advanced statistics. This we rejected. We rejected not because biostatistics is not relevant to the practice of health information management, but because of the type of students we admitted. To tell you the truth, we have a biostatistics course for all our students, and those our students in health information management, their performance, I must say, their performance was close to those of community health, and they were usually below the average. So we felt that if we allow this extra course in biostatistics to be included, that a lot of the students may not be able to pass the course and therefore may not be able to graduate. So that was the reason. That was the reason for that. I'm sure that I had to bring this up because I have specially invited Dr. Gayo Zada. I'm sure he's listening. So just to explain to the board, explain to everyone why we took that decision. It could have been very difficult. It could have been very difficult for several of our students to pass that statistics, because a lot of them couldn't even pass the statistics that we taught to every student of the School of Public Health. Let me also say that the School of Public Health, we are happy that the NUC has a CC marks for the undergraduate program. So which means that we are happy with that, and we are working with the Dean of the Allied Health Sciences, Professor Bunge, to commence the program in our university. In fact, I have invited Professor Bunge to be here, and we'll give him the opportunity to make a short speech to re-emphasize or reiterate the fact that our university, we want to start the school, we want to start the undergraduate program in health information management. So we hope to get the support of the board. The support of the board will be needed. Perhaps if they can send a letter to the Vice Chancellor, they can do that through us, reiterating the need to start the school, the undergraduate program in university. We will greatly appreciate that. Of course, with the commencement of the undergraduate program, the degree program, it means that there is huge need for PhDs, holders of PhDs, and and we have them in short supply. We have them in short supply. So the good thing is that the School of Public Health has a PhD program in health information management. Yes, in fact, the first set will be graduating this year, and I don't know if did we award you that degree? Okay, so the first set will be graduating this year with a PhD in health information management, and we hope to graduate more, and in that we seek the cooperation, the collaboration of the board and even the association, because we need persons that will supervise, persons that are capable of supervising a PhD work in a PhD thesis. The good thing is that our university can accept even those not working in the university. The only condition is that they must have a PhD. So we are hoping to get collaborations from the association and the board. The chairman of the day and the keynote speakers and panel discussants on the team, we are choosing because of their unique qualifications and experience. The chairman of the day, he needs no introduction, Associate Professor of Health Information Management with the Federal University of Health Sciences, Azari. Of course, our special guest, the registrar, the number one person, the number one health information management professional in the country, is here, and he will also speak to us. And then we have the dean, the keynote speaker, the multi-talented Dr. Opele, and the discussants. They will all make valuable contributions during today's deliberation. I have no doubt that they will do justice to the choosing team of the 8th of our conference. Please sit back and listen to these experts. Welcome all. Thank you very much. Thank you. We appreciate that. Sorry. I think we can now go back. We can now go to the chairman's opening speech, and followed by the guests, the special guests. The chairman, sir, can we get Associate Professor Umar Farouk Abubakar? Hello, sir.
Yes, sir.
Are you there? Good morning, sir.
Good morning, sir. I welcome all participants to this important conference today, and we hope that we are going to share a strong professional ideas, knowledge, and experiences as it relates to health information management profession and education at postgraduate level. We look forward to participation in terms of comments, in terms of knowledge sharing, in terms of experiences as it relates to this program, and of course profession of health information management. University of Port Harcourt School of Public Health is no doubt a very strong pillar in the support of health information management profession, because it actually ensures that most of the program are started in that place, especially the postgraduate diploma in health information management, as well as also the masters in health information management, and now PhD in health information management. So it's a very strong pillar as far as health information management profession is concerned, and it has become a watershed as far as the history of this profession. And it has also been making a very strong collaboration with all the professionals across the country, and of course our own professional body, regulatory agency established by the law. And we can see to that today the presence of our registrar and chief executive officer of the regulatory body, as well as other profession. This suggests a continuous. This suggests a continuous collaboration, and we look forward to sustain this relationship mutually and, of course, in unison, so that we further develop the profession. As has been rightly mentioned, the profession is lacking in terms of manpower resources at postgraduate level, which will see to the improvement as far as the development of the workforce for the profession. And this is one of the area of the challenges of this profession, workforce development, especially with the unfolding trends as far as the modernization of the profession and its development, which we are now in the era of artificial intelligence, we are in the era of blockchain, we are in the era of solving problems of interoperability as regards to health information exchange, which will allow seamless integration of information and also data across region, across locations, across various facilities, and even across the world. So we need to also identify some other areas of health information management that is not only technologically based, but also are subject to becoming a kind of extinct, while as defined by AHIMA in the introductory of this program, is that health information is both manual and digital. So we need to also support the hybrid system, considering the kind of our developmental stage, which need therefore to also identify areas of researches in terms of the manual system, our existing coding system, our existing appointment system, our existing filing system, in order to also develop research potentialities in that area, and also develop, information and knowledge to share in order to improve the outcome of healthcare delivery system in Nigeria. You are welcome. We look forward to a very successful deliberation and contributions. And you are welcome once again. And thank you for the privilege given to me to serve as the chairman for today's panel. Thank you very much indeed. I appreciate you all.
Thank you, sir. Thank you, Dr. Umar Farouk Abubakar. Thank you very much for that opening remark. I think we can take the speech by the special guests of honor, the registrar, Alhaji Babagana Mustafa. The registrar, sir, can we identify him so that he can make his okay, he can unmute. Can we highlight him? So we'll take that speech from the #1 health information management professional in the country. Hello, sir, you can unmute.
Okay,
Yes.
can you hear me?
Yes, thank you very much. We can see you. You have a very beautiful office.
Thank you so much, sir. Well, thank you so much, the Vice Chancellor of the University, the Chairman of the day, Associate Professor Umar Farouk Abubakar, the keynote speaker in the person of Professor Jacob Okwele, all the members of the University of Port Harcourt Governing Council, acting provost of the college, dean, faculties, all panel discussants, the president and all its executive members, national president and all its executive members, all the state chairmen, my professional colleague, ladies and gentlemen, good morning. We gathered today to celebrate a significant milestone in our academic journey. Postgraduate education in health information management is key. This field is emerged as a critical component of modern healthcare, driving informed decision-making, improving patient outcomes, and enhancing overall quality of patient care. The importance of health information management cannot be overstressed. The health information management is no longer just about storing, retrieving patient data. It's about enhancing the power of information to transform healthcare delivery. With the rapid evolution of technology, data analytics, artificial intelligence, health professionals are equipped to tackle complex challenges and driven innovation. Before I go further, I would like to reiterate that the Health Record Officers Registration Board of Nigeria, whom I am supervising, is a regulatory body under the Federal Ministry of Health, basically given a mandate of regulating practice as well as training. When you talk of practice, it involves all the processes, starting from licensing, induction up to licensing and so on and so forth. We were even developed guidelines, minimum requirement for establishing the health record department in primary, secondary, and tertiary healthcare facilities. And if you talk of practicing, training, we already have collaborated with a lot of schools. Before then, we are only training HND, the highest qualification. Then we have ND and then health information management technicians. But recent time, we have gotten BSc program initially from private institutions. From private institutions Then later public institutions joined the queue. And we are now boosting of over 15 universities, now both public and private, training our potential professional colleagues at the undergraduate level. So at the potential undergraduate level. So some universities actually came forward and presented their intent to train postgraduate diploma, which is going to be, as you rightly said, the uncle rightly said, is going to be a kind of bridge for them to go into the undergraduate study to get their BSc before they proceed to masters. So as God mentioned, we already have gotten a university, about 6 or 7 universities that have started postgraduate studies up to PhD level. And I thank God, and I'm very proud that we are now boosting of associate professors. We have a lot of them. We have PhD holders, there are a lot of them, and so on and so on, masters uncountable. So this is a great achievement, actually. Importance of health information management is no longer just about storing, retrieving, and patient data. It's also provide opportunities as a postgraduate student in him. You are forced to take on leadership role. Therefore, healthcare organizations, research institutions, healthcare technology companies, government agencies, and even consulting firms are all appeal or an organization that are actually needing our services at that higher level. So therefore, the skill required for our postgraduate program, it should be a kind of advanced knowledge of health information system, data analysis and interpretation skill, leadership and management capabilities, understanding of healthcare regulation and standard, and so on and so forth. So the board has gone further to also develop a kind of developing a kind of specialties that should be instituted in various institutions, especially during the postgraduate studies like masters and PhD, which we already have actually written a kind of proposal. We sent to some of our senior professional colleagues to at least make their contribution. The board has the intention of calling all these academicians in our field come together so that we can now develop a very remote specialties that that can be used in the postgraduate studies or during the study of your master's or PhD program. The key specialties include health informatics specialty. We all know what health informatics means. Health informatics is just a part in the health information management where the electronics and record system involved. Then we also have data governance specialties that will ensure data accuracy, data security, and ethics. We also have information management, health information managers. These health information managers are expected to oversee health information department, ensuring data accuracy, security, effective uses, and so on and so forth. We also have info documentation specialists. We also have data analysis. We also have health information governance, and so on and so forth. So these specialties, there are about 8 of them. We have already gotten the required data contribution from our academicians. So by the time we harmonize all these specialties, the board will invite at least a few number of academicians to come and review the specialty so that it can be a kind of proposed specialties for study of our prospective health information managers. And again, we also have a lot of universities coming to show their intention of, not only training undergraduate, they also have the intention of training postgraduate, and we have memorandum of understanding and so on and so forth. So, but I know the University of Port Harcourt is one of the first universities that approaches both. I could remember with Dr. Marachi and professor, I cannot actually remember his name, came to me, and then we discussed at length on how they will put in place these postgraduate studies, including PD, masters, and PhD. So I really appreciate the effort of the University of Port Harcourt in bringing up this program, especially this program of Health Information Day. It's a very unique, actually unique ceremony, which I think it is the best in its kind, in the country. Therefore, I really appreciate the Vice Chancellor, the Dean, and all other people that actually contributed in the progress of this, especially our young professionals, our young doctors around that area, like Dr. Ada, Dr. Okbale, Dr. Marat, and so on. We have three of them very vibrant health information management professionals, and backing with our other experienced professionals like Dr. Omar Farouk, Dr. Omar Sani, and so on and so forth. So I'm very delighted. What I'm urging the university to do is, to tighten the collaboration between the board and then the institution, so that we can now have a kind of a very strong relationship. And there is one issue I really want to trace on. When you graduate as MSc holder, mostly it will indicate masters in health information management. So now that we're trying to develop the specialty, I think the universities will now key in and maybe adopt the system, so that at the end of the day, if you graduate, you will be specialized. Masters in health information management, specialized in particular either clinical coding or any other field that we are now developing. Not only developing the specialties, we have even gone further to develop the curriculum that you can use to train the specialties, the intending professional. So we really need your collaboration, so that we can, together uplift the image of our profession. When in a shorter period of time, we'll be boosting of, let's say, having professors, which is our predicament, as Associate Professor Omar Farooq said, we are having problem of manpower. The manpower issue is very, very critical. There was a time I met with one BC, Borno State University. We were discussing his own problem is to put in place the Department of Information Management, but the person that will handle that particular department, or people that will handle the department, matters. So every profession actually started in like this. I could remember doctors, nurses, every profession, they started somewhere before they reached to this level. So therefore, we will also have to start somewhere, and we are praying we will sooner reach the level that they are, so that we can be proud and rubbing shoulders with any other profession in the health environment. So I thank you so very much for organizing this very important workshop. I wish you a successful deliberation, particularly the discussants. I want you to actually bring out your skills, discuss a lot of issues that can be useful for us and for the institutions. Thank you very much, and God bless you.
Thank you very much. In fact, I had to stand up to thank you. And I have to thank you not only the perhaps in the little outside I do, but the pride Agassi. Thank you very much, sir. We have planned a lot, but especially this subspecialty, they are going to immediately adopt that. For this our PhD students, they are not doing any. We have to make sure that they choose topics along that line and not just a topic in and call it health information management. They have to choose the topic accordingly. Thank you very much, sir. Thank you very much, sir. So we'll take a good news message from the president of the Association of Health Records and Management, Information Management Practitioners. I understand that the vice chairman will be giving the message. Okay, the vice president. Okay. Yeah. Hello, man. And then my team, the dean of the Allied Health Sciences, is also here with us. Just to think like this. Yes. What of Professor? No problem. Professor Bunge. Okay. I think they will give their Professor Bunge, sir. Hello, sir. Hello, Professor Bunge, sir.
All right. They've just allowed me to mute.
Okay, thank you, sir. Thank you, sir.
All right.
Faculty of Allied Health Sciences of University of Port Harcourt, Professor Bunge, my teacher in the medical school.
Thank you so much. I hope you don't mind me showing my video because
no. You can we prefer that so that at least they can see you.
Oh, you want me to? Okay, I'll just show a little.
So if you are not comfortable with that, you can go ahead.
Again, I'm not allowed to. So okay, there. It's not so bright. Hello.
Hello, sir. We can hear you, sir.
All right. If you can hear me, that's fine. I want to thank you for the opportunity to be part of this conference. The chairman of the occasion, the registrar, and the members of the panel, and Professor Best, especially Professor Best, who made sure I was part of the panel. I was part of this meeting. First, no audio. Can you hear me?
We can hear you, sir. We can hear you, sir. We can hear you, sir.
Can you hear me, sir?
Yes, sir.
Sir, can you hear me?
Yes, sir. We can hear you.
Can you hear me now?
Yes, sir.
All right. If you can hear me, I will continue. So I recognize you all, especially the registrar and all the other high-level members that Professor Best has spoken about. I am not a professional in this field. No, I'm not. But I'm highly impressed by the number of attendants in the very first annual scientific conference. So congratulations to the team. That's excellent. Now, over the years, well, recently, we have been talking about initiating a bachelor's program at the University of Port Harcourt. We recognize the importance of this program. However, there are challenges in initiating it. We have emphasized several times that personnel is important. But at the University of Port Harcourt, we're not just looking for personnel in the area, we're looking at personnel who are already within the University of Port Harcourt. It's difficult to employ because of the embargo that has been going on. But I hear there's a window. So I hope Professor Best, or the letter you're writing to the Vice Chancellor, I assume you're writing a letter, or in the communique, it should be well stated that if the appropriate staff are employed, will be ready to go on. The faculty board has met, and they have in principle agreed to start a bachelor's program in health information management. There are processes involved. We are hoping that Professor Best will help us with the staff to run with this, with the processes that after the board approval, one of which is having a curriculum. So I understand from the registrar's speech that there are some departments in the country that have initiated the bachelor's program. It will be appreciated if you can share your standard curriculum so that it will be used to run with the program at the University of Port Harcourt. I have heard Professor Best. I have heard and understood the series of knowledge he has and the team he has with him. And I'm sure he can lend us some of his team members to run with this program. On that note, once again, it's been a pleasure to meet with the registrar and other esteemed members. So thank you very much. If there is any area that needs clarity, it's available to clarify. Thank you.
Thank you very much, Professor Obunge, the Dean of Allied Health Sciences of the University of Port Harcourt School of the University of Port Harcourt. Thank you very much, sir. I think we'll work together to see that we commence the program. We commence the program. Thank you very much, sir. I don't know if the representative of the president is around. Okay, she's there. Is it Chinyere? Hello, ma. Can you raise your hand so that we can recognize you? Raise your virtual hand, Vice President. Okay, so as we're doing that, after her comment, after her remark, we'll take the citation of the keynote speaker. So we have with us here some of our distinguished members in the States, including our senior citizen, our elder statesman, Mr. Sonic Poga, and Dr. Israel Isaruk, and of course our own, the one we made the doctor, Dr. Israel Imarili. Thank you very much, and of course our coordinator here, and Wosa, one of the members of the implementation committee, and I'm sure that Gaius Ada is on call. No, she can. Okay, have you identified? Okay, please. Hello, madam. Can you unmute? Unmute, and then, if possible, if you can put on your video. and then make a comment. Sorry, we are keeping people waiting, especially the registrar who graciously agreed to be part of this today's occasion. We thank you very much for that. Yes. Hello, ma.
Hello.
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 Yes.
Good morning, Prof.
That is
Good
fine.
morning,
That is fine. Yeah. Good day, ma. You can go ahead with your
morning,
the remark.
All right. Good morning. The VC, all protocols duly observed. I am here representing, in three capacity actually, representing the president, and then myself as the deputy national president, and also as a student of the PhD program of the school. It's a great privilege to be here representing the president, and the president has graciously asked me to give his goodwill message. I want to thank members, thank and appreciate the School of Public Health, UNIPORT, and Professor Best, especially in particular for the establishment of this program. The president has asked me to do that appreciation and to thank everyone who are instrumental to the establishment of this program. This program, he said, that before now, members of the profession, especially from the South, have issues assessing higher education program, especially in the PhD level, that we travel as far as the West. But with the establishment of the program here in the South, it has brought the program home to people down South and opened the doors of academic opportunities to members of the profession down South here. So he is saying that I should extend his arms of gratitude, his voice of gratitude to members and of the UNIPORT management and SPH for this great opportunity that has been given to members of the profession down South. The health information management professional is one very unique, as Prof has said during his opening speech, that is a unique program of which only members of the profession who have advanced to the level of PhD, can be the ones that are involved in lecturing and giving instructions to people in that field to that level of advancement of PhD. Hence, it is a kind of a closed circle. So having the program down South here is a great opportunity to professionals in the South. And the importance of health information management in the services of patients and cannot be overemphasized, just as the registrar mentioned during his opening statement. So we are very grateful to members of management of the SPH and UNIPORT in establishing this program here in the university. Also, we can assure, we want to assure the members and staff of the UNIPORT that professionals who are in the field are ready to collaborate, just as the registrar has said, that we are looking into establishing specialty programs, specialized program and specialty program where people can diversify. He mentioned 8 different areas of such. And in no time, I believe, just as Prof responded after the registrar's speech, UNIPORT will do that. And then professionals will engage with UNIPORT in ensuring that we key into this specialization program and bring the best out of health information management practice. Before now, the program didn't have areas of specialization or areas, the PhD program. Now that we have it, we can assure the school and that we are going to collaborate with the management to ensure that this program gets its best, gets professionals who are in the field to do the needful in joining, in training people in health information management practice to give our best. Then we would like also, the president has given his word that in whatever way, in whatever capacity, in whatever area that the university needs for us to collaborate with them in ensuring the best, that they should not hesitate in bringing out such needs forward to the association and to the board, and that we are ready to collaborate with them to ensure that the university gets the necessary manpower in carrying out its duty of training health information professionals in the field that is necessary. Thank you very much, and God bless you.
Thank you very much. Thank you for the reassurance and the appreciations. Thank you very much, Madam Vice President. Thank you. So we are getting close to the keynote lecture. So we'll take the citation of the keynote speaker. Let's take the citation of the keynote speaker.
Dr. Jacob Kehinde Okpele won a unanimous vote to give the keynote address on day 8 of the first annual scientific conference of the University of Port Harcourt School of Public Health. He won the vote for his academic and professional qualifications, for being an engaging lecturer, an erudite researcher, a journal editor, and most especially for being one of the leading academics in health information management in Nigeria. Dr. Okpele obtained his National Diploma and Higher National Diploma in Health Records and Information Management from the Obafemi Awolowo University Teaching Hospitals Complex, Ile-Ife, which qualified him as a Registered Health Information Management Professional under the Health Records Officers Registration Board of Nigeria. He advanced his studies with a postgraduate diploma in technology management from the Obafemi Awolowo University, Ile-Ife, before earning both a master's degree and a PhD in information resource management from Babcock University, Ilishan-Remo, Nigeria. Dr. Okpele served as Institute Librarian of the National Center for Technology Management, an affiliate of the Obafemi Awolowo University, before joining the Federal University, Oye-Ekiti, as a lecturer, where he now serves as an associate professor in the Department of Library and Information Science. His research interests lie at the intersection of knowledge and management, health information systems, and interprofessional collaboration. He has supervised numerous master's and PhD students, including students of the University of Port Harcourt School of Public Health, with over 100 publications in peer-reviewed journals and contributions to major texts on team lead with the Health Records Officers Registration Board of Nigeria, playing a central role in shaping and accessing the standards of training and practice of health information management in the country. Distinguished guests, lecturers, students, ladies and gentlemen, behold Dr. Jacob Kehinde Okpele, Registered Health Information Management Professional, Associate Professor, Department of Library and Information Science, Editor-in-Chief, Living Spring Journal of Library and Information Science, Regional Assistant Editor, IFIMA, and Keynote Speaker, Day 8 of the first annual scientific conference of the University of Port Harcourt School of Public Health.
Thank you very much, Dr. Okpele. I don't know if... Hello, sir.
Yes, sir.
Yes. Thank you very much, sir. Dr. Pele, you can now give your keynote lecture.
Well, good morning, distinguished ladies and gentlemen. It's actually a great honor to be part of this program. But first and foremost, I would like to give glory to the Almighty God, who is the organizer of every human activities. So I want to sincerely appreciate the Vice Chancellor in absentia, that's Professor Owunari Abraham Geoffrey, Vice Chancellor of University of Port Harcourt. I want to appreciate all his deputies, the DVCs of the Federal University of University of Port Harcourt, deans, directors, all principal officers of the university, as well as students of University of Port Harcourt in general. But in particular, I want to sincerely appreciate our own Professor Best. Actually, his name is synonymous to the growth of our profession in Nigeria, because since the beginning of this program, we have maintained the best. And it's a great privilege to work with you, sir. We are grateful to have someone like you in Nigeria, because the roles you have played since the inception of this program around 2020 or 21 has been unique. In fact, has been the best. I want to appreciate my own registrar, that's Alhaji Babagana Mustafa, who is the Registrar, Air Records Officer, Regional Board of Nigeria. I want to appreciate the entire member and staff of the board. I thank the present and the past national executive members of our profession, particularly that's Barrister Wani, who also double as ex-official of our national executive. We appreciate the entire team currently at the national level, where we have Comrade Michael Luka Malo as national president. We've just heard from the national deputy president, Ms. Chinyere, and others in their team. I want to also appreciate the students who have actually taken that bold step to be part of this program. If you look at the number of those who tie into this program, there are almost 300. So I say thank you to all of you to be part of this program. Now, I want to count this as a great honor that we have our chairman of today's program, that's Associate Professor Umar Farouk Abubakar. Just as Mr. Chinyere mentioned what is going on in the South, then also up north, we have people like you. Thank you for being part of the program. I want to also appreciate the panel discussants on the team. All of you are well appreciated. Now is the time to go straight to the title of today's presentation, which we call the keynote speech, Postgraduate Education in Health Information Management. Of course, a lot will be expected from me today, but I want to humbly say that knowledge is dynamic. It's not for only one person. It is something we are all going to enjoy together. So permit me now to share my slides so we can see exactly what I'm presenting. So if you are seeing my screen, I want to restate the title once again, Postgraduate Education in Health Information Management. So I'm trying to do something that will make it a little bit much bigger and reader from your hand. I'm trying to operate my slideshow, though covered by the screen menus. So I want to believe you are seeing my slides from there, from your various locations across Nigeria. This topic actually will not have come at another or any other time than now, when the need for HIM at the advanced level is high across the globe. So throughout the world, we have the need growing every second for experts in HIM health information management. I'm still trying to see the slideshow so I can bring this to a larger screen. Yes, I think I've achieved that now. So once again, it's an honor to present this keynote address at this first annual conference or scientific conference and alumni meeting of the University of Port Harcourt School of Postgraduate Studies, Public Health, Rivers State, Nigeria. So what are we expecting in this presentation? It's very important for us to have an idea. This presentation is one of its kind, and in fact is the first of its kind in Nigeria. And it's a great honor once again to be the one presenting it. We all know that in the health sector, we have so many disciplines: medicine and surgery, nursing, pharmacy, laboratories. We find out that in all of these disciplines, HIM has been the only one that has been suffering from people expertise at the advanced level. So immediately we got to know of this, we were so happy. And this presentation today will tell us essentially what is a PG education in HIM, and it will also compare the model that we are running in the developing countries with what is going on in the developed country. It will conclude by telling us the way to go if we actually want to compete and be at par with others across the globe. So let's start by understanding what a postgraduate education is. We are, majority of us on this program are either or students or interested group. This terminology is not very scarce like that. It's not something that we don't have an idea. But for the purpose of this presentation, let us see how it connects. Well, we can describe postgraduate education as an advanced academic study that occurs after completion of an undergraduate program. So in other words, you cannot venture into PG program if you are not once an undergraduate student, which means it's a program that encompasses various forms of education. We've heard about master's degree, we've heard about doctorate degree or doctoral degree as the case may be. We've heard about diplomas and professional certificates. So now let us differentiate these programs. You are possibly in one of these categories of the programs. Let's start with master's program. This is actually required, and it involves a program that takes you 1 to 2 years of study. Beyond that, your BSc, and eventually you have the following titles: Master of Business Administration, if you do it in business and administration and management. If you do it in education, they say Master of Education, that's MEd. If it is in science, they say MSc. And now, our own is MSc Health Information Management. And if you do your postgraduate master's degree in arts, they will say Master of Arts. So that's what you carry. Now, after that, you decide to proceed to doctoral degrees. This includes a program that they say PhD, Doctor of Philosophy. Sometimes we also have professional doctorate too. So each of these requires of research and coursework, which eventually lead to a dissertation or thesis. So when people finish their coursework, they say, I'm done with coursework, now I'm on my thesis. And then you see that, how many years have you spent? You will say, I've spent, this is my 3rd year. Other people say my 5th year, depending on the speed and their circumstances. So what have we said so far is that master's is a postgraduate education, PhD is the senior, and their years of training differ. While a master program takes 1 to 2 years, PhD takes minimum of 3 years. There are others. We have PGD, that's postgraduate education. It can be, you can be in education in any discipline, but it is a diploma after your degree. We also have certificates and diplomas. So these ones are shorter programs that provide specialized training or knowledge in a particular area, often without the commitment of a full degree. So, or full calendar with a master's and PhD. We also have continuing professional development programs, such as those ones organized by the board. They are designed primarily for professionals to enhance their skills and knowledge in their field. Oftentimes, it requires maintaining license or certification. Oh, you're a licensed member, like Prof said. He said he's also a licensed, he's a qualified practitioner. So the license is issued by the board, and sometimes those who don't have primary degrees in HIM are given this privilege to have certificate training, continuous education training, and eventually they are given a certificate to practice. Now, we have that of postgraduate education, which involves rigorous academic research, advanced coursework, and practical experiences. All of these PG program aims to deepen expertise in a particular field, preparing you as an individual for higher level positions, and then contribute to professional and academic communities. So as we move on, our attention will be primarily on PG program in HIM. So how do we define that from others? Well, by definition, it simply means the field of health information management where people actually enroll. Sorry, my screen is being covered by the menus and I'm trying to move it accordingly. Okay. Good. It's a field that is growing rapidly today, both in enrollment, in postgraduate programs, and in demand for skilled professionals. In other words, gone are the days when they say, where are the card issuers? Now people are looking for health information professionals across the globe. And as we go, you will see what is happening across continents on Earth. So as healthcare systems worldwide increasingly rely on data and information management, the significance of postgraduate education in HIM will continue to rise, underscoring the need for robust educational programs globally. Now, let's look at some images that we have upstairs. If you look at your screen, you'll see different images. What are they saying? How are they connected to postgraduate education in HIM? One thing that you can pick from here is that usually postgraduate education is not a very large class like we have it during undergraduate days, where you have 200, 300 undergraduate students in a class. Sometimes PG will be as small as 10 or even less, sometimes 15, particularly if they are not virtual like the one we are having. It's usually short. The number of participants or students are not as big. So there is very effective communication between the teacher and the student. And you can see all of them. All the various images you see here is pointing to the fact that it's an interactive atmosphere where there is bridge between theory and practice. Oh, what's your experience from your place of work? This person will narrate his own, the other will narrate his own. Then the teacher will connect the theory to practice. They have taken that. So it's a program that we should all desire to be part of, because the more we have, the better. Also, postgraduate education in HIM focuses primarily on advanced studies and training that has to do with managing health data and information system within healthcare setting. When Prof said it's a unique program, it is, as it has also been emphasized by others, including my registrar and the Deputy National President. It's a unique program, and it cannot just be taken or taught by just anybody. The advanced training in the management of health data is different from management of general data, where somebody say, I have the knowledge of Excel, I can do this, I can do that. We are talking about someone who understands hospital-based, health-based data. He is already familiar with this terminology, and as we move on, we'll see some of them. So this specialized field combines health care with information technology as well as management principles. So unlike so many other disciplines that focus primarily on clinicals, ours is all encompassing. It combines health services with information technology and management principles, such as planning, organizing, directing, budgeting. A professional information person who has acquired postgraduate degrees to be able to manage these three areas very well. And the whole idea is to ensure the efficient handling of patient information and health records. Now, let us see today, in a PG program or PG education in HIM, what should be taught? What should we be expecting? We should be expecting content on the following areas. Some of them were mentioned by my registrar earlier. One, a PG program in HIM should address health data standards and regulation. So when you graduate as a PG graduate, say a PhD holder in HIM, you should be able to understand what health data standards are. The regulations that guides health data management should be part of you. So people can engage you. The management can invite you. We are trying to expand our policies in this hospital, and we want you to tell us what we should include in HIM. Then you will be able to come boldly and say, one thing you should include is health data standards and regulations. Another one that should form part of the core subject in a PG program in HIM is health information systems design and management. You should be able to understand a system, how it works, both the inputs, the outputs, the processes of HIM. So I would say we are trying to come up with electronic health record system in our hospital, and you are invited. You say, oh, we learned you have a PhD or a master's in health information management. Can you tell us what we should do? In health information system design and management, you should be able to tell them, which means as we move on in our programs across Nigeria, we want to make sure component of health information system design and management is included. Another one is data analytics and visualization. Yes, the registrar was trying to tell us some of it, defining it earlier. What are we expected to do? In our PG program, there should be a part that addresses data analytics, data visualization. So we understand all these critical terminologies of today. Now, a PG program should also have, as part of its core subject, privacy, security, and ethics in health information. So there's ethics everywhere, but we are talking about the one that centers primarily on HIM. It should be core component or core course in the program. And lastly, health informatics and technology integration. So if somebody say, I'm a PhD holder, I'm a master's holder in HIM, you should be able to understand these 5 areas that I've highlighted: health data standards and regulation, health information system design and management, data analytics and visualization, privacy, security, and ethics in HIM, and health informatics. So which means if we have association within the country that has each of these in isolation, there is need for them to actually work together so that we have a robust, a complete association of health information practitioners with all this diverse area. Before, when we were students, all we knew was health records management, biostatistics, clinical coding. But now, we are now seeing today's own that will make our work much easier. And with the arrival of AI and other technologies of the 21st century, these are the ways to go. Now, other things that should be included in a PG program in HIM is skill development, ability for you to learn and analyze health data should be part of the program. Students should be exposed to health data analysis. They should have that skill. It can be in form of certificate, like Prof emphasized earlier. Professor Best told us that we are trying to come up with short programs. Now, if we have something on health data management, health data analysis is a skill that we need. We also need the skill to manage electronic health records. Like throughout the Federation now, we have health in a bus. If you are posted to any unit of HIM in a teaching hospital, for example, or federal medical centers, will you be able to navigate your electronic health record system? This is a skill that you have no option than to acquire, because you will be operating like a typical banker or bank staff who interact with thousands of customers daily. And if it's not able to interact with the system, it will have problem. So part of the skill required is using information technology, IT, in whatever form, to actually improve healthcare delivery. So we have gone beyond manual medical records. Everybody is now narrating their stories when it comes to electronic health records. And without you understanding the use of IT, you cannot do anything. So your functionality will be very limited. Also, today's skills in HIM should address leadership. Most times, our leaders are a little bit biased because of the limited exposure to some of this modern knowledge. This is what I mean. As a knowledge manager, you know that the knowledge, we have little of it in the heads of everybody, which means you can't do it alone. So the management skill include leadership skill. These skills and competencies must be acquired as part of our PG program. So that when you go back, you lead you are working with a team, not alone, not solo, but as a team. You are talking about collaborative, you are talking about interprofessional and things like that. Not only that, you should understand what strategic planning is. So all these are skills that are required at PG level of HIM. When we say strategic planning, it's not the general planning. It's a plan of action that is packed with solutions to problems, steps to take to solve certain problems and things like that. So when we say strategic, is one that involves very few people with high level of knowledge. And then apart from that, you should understand or have the skill of change management in healthcare organization. We all know that change is constant. What we are used to 20 years ago, today, change has catch up with you. You cannot function again. So what are we expected to do is to develop these skills. So when you are talking, people know a professional is talking. When even it's not about the vocabulary you are using or how big your language is. We are talking about someone who is a solution provider, not someone that will be creating problem, not problem creator, but a solution provider. So these skill development are also required of a modern day HIM practitioners. You learn data analysis skill, managing electronic health records, use of IT to improve your healthcare, emphasis on leadership, teamwork, management skill, strategic planning. You plan, the planning comes at different levels. We were talking about the strategic one that involves those who are experts in their various fields. That is not enough. You also need to understand practical experience. In the past, very few people are good when it comes, like Prof said that they were trying to bring, is it biostatistics or pure statistics, and they are afraid that our people may not be able to survive it. Many programs today in the developed world that has to do with HIM also include internships. In other words, from now on, the management of School of Public Health in UNIPORT should find a way of including this internship program or training as part of what is expected of a graduate of HIM. Please permit me, I notice my battery is dropping. Let me just check my charger, please. What's the... So as I was saying, the practical experience also matter and it should be embedded in our program. So when we say we are running HIM at this level without practical experience, then it's also incomplete or imbalanced. So our students should be exposed to this internship program in healthcare setting that provide real-world application of theoretical knowledge. So they will be able to bridge the gap between the theory and practice. Also, other things that we need to do is this certification stroke professional development. Board has actually certified us. We can also be certified by international bodies in Australia, in US, in Canada, so that when we have reason to travel, we can navigate easily. Postgraduate education, which prepares students for certification in HIM. Then the continuing education should not suffer. Short-term programs that will expand our horizon, that will make us appreciate knowledge better. We want to take advantage of it. If we do this, we will be up there. But now, a small question is, what is the importance, overall importance of postgraduate education in HIM? Please still allow me to check this my power source. It has been on since 8. I didn't know that I didn't power it well. Yeah.
No problem. Just take time to look at it, especially if you have electricity.
Yes, I have.
Thank you very much. Yes.
Yeah, I'm back. My system is okay now. So we have importance of PG education in HIM. I have highlighted 3, and these 3 are key. The whole idea when you graduate is to contribute to quality improvement, policy development, leadership roles. In my former employment, where I serve as the institute librarian, it was actually a policy institution. I came to realize then that policy guides everything that we do. So now when you graduate as a PG, let's say a doctor of HI, a PhD holder in HIM, they now say, please, we are trying to come up with policies. How does it sound to you? Do you just mentally travel to Abuja and say it's only Abuja people that make policy? No. Now let us see what is involved in these 3 areas. One thing is that quality improvement involves everything that has to do with enhancing the quality of healthcare delivery by ensuring accurate and timely access to patient data. This is what we mean. You are at the clinic, a patient comes without booking, and you say, no, we are attending to only booking or books to patients. And the person says, please, I am dying. Please, I am dying. How can you assist that person actually to get accurate and timely access to the care that is required? Or a researcher, a consultant, a resident doctor is around, is telling you, please, I need data in this area. Can you please provide it under the normal ethics of your practice without much stress? Or you want to say, yes, maybe you have come to meet me in our clinic now. A professional doesn't revenge like that. When you are working professionally, you do your work professionally and you put a fight aside. When you finish serving that person, you can revisit fight when you get to town. Policy development. Why is it important for postgraduate education in HIM? It's because it equips professionals to contribute better to healthcare policy making and strategic planning. So if you don't understand what policy development is from the class, you cannot contribute anything when it comes to practice. Leadership role has been emphasized repeatedly. It prepares you for a leadership position. You come back the same day, say, wow, I learned you are now a doctor. You say, yes, I'm coming up with a policy, a committee that will look into ABC. Can you please give me a draft of what we should be looking at? Will you be saying, yeah, I'm in trouble. I didn't know now like this it be. Now like this, once you are a PhD holder, you can be called anytime. You should always be ready, and that means whatever assistance you receive outside the classroom, maybe while writing your project or elsewhere, you want to combine all of them together. So you become a complete person. When you are called upon anytime, you are there. So it prepares you for leadership position in healthcare organization as a whole, because it focuses or helps you to focus on managing health information system effectively. So when we understand the need for quality improvement, policy development, leadership role, then we are there. Even if you travel abroad, you will still be operating within this. Now let us see some of the atmosphere where you can get those 3 things that I said earlier. If you are seeing my screen, look at this classroom setting. You see everybody looking at the teacher. It's a two-way thing. The teacher is explaining. They are also learning. So at the end of this quality classroom where you are, would you come back home and remain the same? It shouldn't be. The gap has already been established. What is needed is to bridge the gap between hearing, that is the theory in the class, and doing, that is the practice. So when we bridge the gap between theory and practice, we become a complete professionals. You can work with anybody collaboratively. Now let us see this table that we are seeing. This table is actually telling us where are we. It is telling us the current landscape of postgraduate education in HIM across the globe. In Africa, in Asia, in Europe, in North America, Oceania, and South America, I mean. The information you are seeing on the screen was extracted from WHO, IFIMA, and co. So it's not something that I just brought. Now, what is the table telling us? It's telling us that today in Africa, HIM is an emerging program. I mean, at the advanced level, master's, PhD, postgraduate education in Africa is emerging. And in South Africa, we have a number of schools that are already doing it. In Nigeria, we have many. Our registrar told us the other time that about 15 universities are already running a program at the undergraduate level, and about 7 or so are already engaging in postgraduate level. So it means in Nigeria, in Africa, it's an emerging program, and it's emerging very fast. But these 3 countries took the lead: South Africa, Nigeria, and Kenya. So in other words, if you have a business in South Africa, you will still meet schools that are doing running HIM at the postgraduate level. If you go to Kenya, you will see them, and in Nigeria, you are in one, which is almost the most vibrant among all the schools. I want to say thank you to Professor Best for helping us to manage this program like a child, like his own child. And that's the way he's been treating all of us that are called upon. Now, the number that you see, number of programs, we have several in Nigeria. At least we have 7 universities who have now started postgraduate in HIM. Then job market in Nigeria is increasing. There's increasing demand for HIM professionals. Many doctors who want research grants, they want HIM professionals on their team because they believe that these ones understand data management. Imagine after your master's and PhD, you are invited. Oh, can you be a member of our team? We are trying to put a proposal for a grant. And then they say, come, and you say, no problem. Eventually, the grants come. They all say, please, give us a template of how we are going to manage our data. You say, wow. No, it's the theory that we learn in school. I have to call Professor Best to guide us. No, you're already a professional at that advanced level. So we expect you to give more than expected. Now, let's see what's going on in Asia. There's rapid expansion in India and China in particular. They increasingly recognize certification in HIM. So if you travel to any of these countries, you can have certification in HIM. And the study shows that we have up to 20 universities in India and China that are currently running master's, PhD in HIM. And if you look at our story, our history from beginning, some of our founding fathers today who gave birth to HIM in Nigeria actually went abroad to study. And there's growing demand in those countries, leading countries in Asia, that India and China. The growing demand in HIM is due to healthcare expansion in those countries. So they are going very fast. They are going fully automation. And if they are automating, they need someone who understands this aspect of managing patient data to be in their group. In Europe, we have established programs. Their own is very stable, particularly in the UK. Our founding fathers like Ogbewe, Akonji, those elderly ones actually went to UK then to study HIM. And we have up to like 25 universities that are running postgraduate program in health information in Europe. And the reason for this expansion is because of the growing demand for HIM professionals. And if you come to North America, where US is, United States alone has more than 90 universities that are running HIM. In fact, they have a projection of, projected growth of 13% within the next 10 years. They say between 2020 and 2030, they will have 13% growth in the expansion of universities that are running HIM in US alone. How about in Oceania? We have some programs, particularly Australia. Several of our colleagues have traveled to Australia several times because they used to host HIM program. They are very well established when it comes to our program, and there are so many universities in that continent or that country that is already undertaking our program. The reason for the expansion is because they already have a stable demand for qualified professionals in HIM. So when we have a demand for, then we need schools to produce these experts for us. And in South America, there's also a growing interest in HIM education, particularly in Brazil and Argentina. Although the number of universities are not many, however, there's increasing demand in urban areas of this country because they have so many hospitals where they need HIM professionals to work. So what have we said in this table is that Basically, these countries have different levels of engagement in HIM. However, it tells us that it is actually increasing globally, that is HIM is evolving with varying degree of development across continents. Why North America and Europe lead in program availability and professional development, we in Africa and part of Asia are rapidly catching up, driven by a growing recognition of the importance of HIM in modern healthcare systems. So, this keynote address, now from this slide, compares the model of PG education in HIM in the developed world and developing countries, and highlighted key differences and similarities that we should keep. The first one has to do with the areas we want to emphasize, which is curriculum development, teaching methodology, research engagement, professional development, community involvement, and evaluation and feedback. What am I saying? There are 6 thematic areas that our PG program should address. Apart from the skill development that we have mentioned, the issue of internship, there are these other areas that are key, because this one will naturally bring those expertise into the minds of the students who are learning. So let's look at the first one, curriculum design. Now, in the developed countries, what do we have? In the developing countries, what do we have? Well, in the developed countries, with regards to curriculum development, the emphasis is on advanced data analytics, health informatics, and policy development. You will notice that before this slide, we have emphasized the importance of policy. We have talked about health informatics. We've talked about data analytics. That is what they are looking at now. But what is happening in the developing country? Reverse is the case. Traditional methods of teaching. People must come to class and then the teacher will stand in front of them. And the reason is because there's limited access to technology. Also in developed countries, what they are focusing on is interdisciplinary approach. In other words, they are integrating courses from neighboring families like public health, computer science, data science. When Prof says that within the public health, Institute of Public Health, that they have a number of courses, was it 4? Now from these 4 different areas, we bring lecturers to teach us little component of what's going on there. So when we get out of the class, we are going to work with these various professionals. So if you are not familiar with what they are doing or familiar with what they are doing, you will not be able to function well. So in the developed country, they pay attention to that interdisciplinary approach. So as we try to expose our students to various course content, this must be a key that we should emphasize. Integrating courses from public health, courses from computer science, and courses from data science. That's why in the past, some of our colleagues went to Department of Computer Science to have their first degree, so that when they have that, it will prepare them to manage the electronic component of our services more effectively. But in developing countries, what do we have? Our learning is community-based learning. We will start writing letter to someone, we are coming to his community before we can give him knowledge. But in the developed world, the attention is not like that. They focus on research. They play emphasis on research methodologies and evidence-based practice. Like Prof said, he said that in the past, many of us were produced by librarians. It is true, including me. And that's why I find myself in the Department of Library Science today. But we are talking about core HIM that is evidence-based. So if our focus is not on evidence-based research methodologies, by the time we are supervising, we'll be saying another thing. So I remember during the proposal defense, Prof said, wow, this your methodology is somehow strange to me. We measure items, but in the real research, we look at quantitative data, continuous data that we can use to add 1 plus 2 to get the mean value. And then we'll be able to we'll be speaking using data. So when we say evidence-based practice, it's a practice that tells the student As you are going back to your place of work, go with this assignment. When you come back next week, you are going to tell us how they are doing it. So when you go to the north, the south, the west, the east, we'll be sharing knowledge, and then we can come up with a decision that going forward, this is how it should be run. I haven't seen what's going on as evidence-based. But in Africa and other developing countries, we have issues in that area. How? We don't have mentors. The mentoring opportunity is very slim. Though we may have some informer, maybe someone take interest in you, say, let me mentor you. But in real sense, the mentorship as a program is lacking. So if you compare curriculum development without mentoring, you cannot do it because you are just coming up. Somebody must be there to mentor, and it should be part of the program in our advanced level. The second thing is, look at the pictures I have on the screen here. If you are there seeing it, you will see to the right, top right, you see a guy in the white, like hospital uniform, so to say. And then you see the students. What they are doing is that they are looking at how they can integrate technology into what they are doing. And the teacher is trying to tell them, for example, we include this, we include that, and they are getting it. If you look at the middle one, you will see that data visualization, they are presenting data using graphs. People, they are understanding it. If you look at the left side, top left, you will see electronic medical records. These pictures are not just there. They are telling us these are the things today curriculum should address. How do we manage health data? How do we present health data? How do we come up with our components? If we understand all of this, we will be fine. Now, teaching methodology is another area that the school at the advanced level should address. Now, let's look at 3 things that are common in the developed countries. 1, they use blended learning. Where we are now, we are all in our various comfort homes, and we are connecting to the same location. So we are blending physical with this virtual. So in other words, though it is expensive to use, but this online platform that is sometimes combined with classroom instruction is better. Now, when you come to developing country, what we have is traditional method, which is predominantly lecture-based. And the reason is we don't have facility to embark on blended learning. So there's limited access to technology. And all of these are issues. When I was thinking of where to have this my class, I had about 4 locations in mind, which are institution-based. I got to the first place, there was no light. The second one, their network has down. So the question now, if you have those issues, how will you be able to embark on blended learning where you combine classroom with online platforms? So, but that's the way to go. How about collaborative learning? It's another thing. I talked about collaboration earlier. Group projects, peer reviews are common in collaborative learning, and that's what they do in the developed country. But we here is community-based. Classroom, face-to-face, teacher and the student, and then individual persons writing project. Whereas we can combine 2-3 students together to write a project, come and defend together, educate us more. Sometimes it's not project in terms of dissertation I'm talking about. We can look at other projects that students can use to enhance their knowledge within HIM. Mentorship program is what they are introducing in the developed country. They emphasize on mentorship from experienced professionals, so that those who are not experienced or unexperienced or inexperienced people will learn from them. But what we have in Africa, limited mentorship program. There were fewer structured mentorship opportunities. Others are just come, I'll put you through. So in our PG program, we want to emphasize to our students that in our teaching as we are going back home, we have to put it there, the importance of mentorship. Then, let's see some of these teaching methodologies that should be embraced today. If you look at my screen very well, the first to your left, top left, you will see online courses like the one we are having now. Yes, students are in their comfort zone, they are in front of their computers and they are learning. Mentoring is there. You also see the face-to-face classroom where necessary. All these should be embedded in our teaching methodologies. Research components. Postgraduate program cannot afford to toy with research. Now, in developed countries, what they have is robust research opportunities. In other words, they made funding and resources available for research, including innovation or innovative solution in HIM. The hospital will say, okay, HIM people, this is what you should do. And that reminds me of what happened in my university last year. My vice chancellor said each faculty should produce 10 NRF research proposal. So we want to apply for grant. So if we have 10-10, we have 12 faculties, and we have 10-10 across 12 faculties. Eventually, this is pushed forward. We may get maybe 1 or 2. Now, for your information, out of the 12 that we submitted last year, my team was among the 3 that we got. The point from there is that research, understanding research, the processes involved in research, from selection of topic to your reporting or outcome of your overall activity, students should understand it at this level. So a PG student, a PhD student should be able to lead a research, lead a team, so that they can get funding. So they should be exposed to how to get this done. Then, in particular, institutions should be willing to make funding and resources available for research or research projects. Then, in the developed country, once students are done with their research, the next thing is you have to publish and come and disseminate your result. I didn't wear cap. I would have doffed my cap for Prof, who mandated all the PG students to make sure they write at least an abstract from their projects. And we're happy that a number of our students will be able to present today. So that is the way to go. We're already there. Thank you very much, sir, dear Prof. Then in developing countries, where are we? Where there is limited research opportunity due to funding challenges, funding and resources challenging. This will actually restrict our research capabilities. Then what we get is local funding. Well, I'm happy that my team got that one from national funding. From national, we will go international. So what we are saying is students should be exposed to, and our curriculum, our research component should address the importance of research opportunities, importance of publication and dissemination of our findings. Students should be shown how to write papers. They should be shown how to publish into good journals. Now, let's look at components that we are talking about. If you look at my pictures on the screen, you will see to the right, top right, you see project stroke seminar. Students should be exposed to project writing. They should be exposed to seminar presentation. So when they are given seminar topics, by the time they present, eventually when they graduate and get back home, they will be able to present to their employers or in their hospitals. There are also in form of educational programs. Any of us can be invited, just as I was given the privilege, to come and talk to an audience. If you are not familiar with this component, will be lacking. Now look at the top left. You will see protected health information. Students are told the importance of confidentiality. They are not just told, they know how to carry it out, and a lot of it like that. If you look down central of my screen, you see 2 people exchanging certain information, though in a very restricted area. But what we are saying is that they are telling themselves part of the findings they got. It could be clinical findings, it could be normal research findings, but we should be able to get the understanding of all of this. Now, professional development is another thing. How is it done in the developed countries? How are we doing it now? Certification pathways, they encourage people to get certified. That's why when you travel abroad, they will say you will do their certification program. You want to travel as a nurse, they will say you will do this nursing exam. As a medical doctor, you do this. In Canada, I had a friend who left us last year. He was telling me 2 days ago that he has resolved that he was going to learn to get a diploma in HIM. I said, why? He said the market for HIM in Canada is even higher than that of a medical person, a medical doctor. So in other words, they encourage their members to get certificated. It's not just master's PhD certification we are talking about now, other professional specialized training. Students should be exposed to those training that are available within Nigeria, some within international body or within Africa and beyond. Then also, they should be encouraged to engage in continuous learning opportunities. I'm happy that our registrar emphasized the importance of this continuous education program, and is already doing well in that regard. Our friends, please try and voluntarily participate in these programs. Your knowledge will not be the same. And participate in regular workshop and training which are available within our profession, so that when they are talking, where are we? You will not be talking where we were. So in developing countries, what is the experience? There's limited certification option. In HIM in Nigeria, it's only board certification we have. Recently, we are hearing about clinical documentation improvement. It's a certification. I have it as I speak with you. We can try to aspire to get such. So if eventually the management or the government is looking for who to engage, they will say, if you know you have this certification, apply. You cannot apply if you don't have it. Even though we have fewer recognition of this in Nigeria or that are available in Nigeria, we want to maximize those ones that are available. The international one too, we want to try to take part. Then there is need for training from time to time. So we should emphasize continuous professional development. So board should make it a compulsory requirement for our members. Nurses do the same. Medical doctors also do the same. Nigerian Medical and Dental Council, make sure you go on this continuous program. If you don't do the continuous professional development program, your knowledge cannot be up to date. Now, look at your screen again. To the top left, we have various professional development programs we can expose ourselves to for the purpose of leadership tomorrow. One of it is communication, ability to speak to your audience in a language they will understand. We are not talking about vocabulary now, but when you say you are studying, you are teaching HIM, can your students remember what you taught them when they get home? The written, the verbal communication, we should have training in those areas. Board can also organize it. We have leadership management in health information practice. It can be a short-term program in our continuing education program. Then health and well-being, people in sport and people in health education or people who are in public health can tell us what we need to eat. We take all this one to benefit ourselves and our institution. Career navigation. Okay, after I'm HND, what else can I do? We should have short-term programs like that will expose us to those opportunities. And if you look at other screen, you will see all of these pictures you see are all engaging in one professional training program or the other. And you see their faces radiant and beautiful because they are enjoying it. Now, second to the last in the point I'm bringing out is community engagement. As a PG student or in a PG program in HIM, there is need for students to follow the model set in the developed countries. And what is the model? Service learning. There is integration of community service project into curriculum. This one will actually enhance learning. How are they doing it in your community? Tell us your experience in your community and all of that. Then there's partnership with organizations. There are so many organizations, like Prof said, they bring people from the industry, from the hospital, from the academia. Yes, we look for where we can form collaboration. And once we have strong collaboration with healthcare organization, our practical experience will not be the same. In the developing countries, we are still focusing on community-focused projects. Emphasis is on community engagement to address public health issues. Of course, public health issue is fine, but most times they are government-based issues. The one that concerns us as individual has to do with those ones that are service learning, which has to do with collaborating with people we can tap knowledge from. Then partnership with local institutions is what we have in the developing countries. We collaborate with local government, with local departments, but in the developed world, they are looking for international organizations to partner with. Look at the picture again. What is the ideal community engagement curriculum that we should have? If you look at top left, you will see a collaborative hands. Different hands are gone together, telling us that when we say ideal community engagement, it should be an engagement that talks about collaboration, partnership, linkages. So all those things will help us to do better. And when we have to engage the community, we want to bring them to an environment where they can receive instructions, lectures, seminars, and when they go back, it will impact on them. Depending on the location, if you look at bottom right, if you look at my right bottom there, you will see similar engagement taking place under the tree. That's where we don't have resources at all. So we want to make ourselves available to serve our community as either as a student or after graduation. They will know us and they will appreciate us for that. The last one is evaluation and feedback. Our students should be exposed to what it means to evaluate certain programs, what it means to get feedback. So now, what is the situation in the developed countries? There is continuous assessment. So what we are saying is that a PG program in HIM should regularly assess students through various formats. So they monitor their progress. In Babcock University, where most of us that have PhD today graduated from, there is this monitoring student progress reports. Your supervisor will immediately work on your project, he will sign. They said they should bring a form where they will say, I have asked students to go and do this. And then the students say, my supervisor has asked me to do this. If you now go 6 months, you didn't come back, you cannot say, my supervisor don't have my time. He will say, go and look at your progress report. When last was it signed? So we should be expecting that from our supervisors, from our classes. They should tell us there's need for us to monitor, there's need for continuous assessment, not necessarily test and exam. We also want to see where are you on your projects. Then feedback mechanism too is important. The institute should establish channels for students to provide feedback on their educational experience. Tell us your experience. After we finished from Babcock, they wanted to get an accreditation. And then the accreditation team told them that they want to see how their graduates are faring. They told us that we should send them letters of our appointment, our promotions. Some of us were institute librarians, some are university librarians, and we were telling them. So when NUC people came and they saw these success stories, of course, you know what that means. They will automatically grant them their request. How about developing countries? Because of these limited assessment methods, we are still suffering. We rely often on traditional exam method. We have to write examination with less emphasis on continuous assessment. Then we have informal feedback. Don't worry, okay, I've called my supervisor, and that's all. There's nothing to show. Feedback mechanism may be less structured, and most times it leads to limited responsiveness on the part of the student. So look at the screen again. Evaluation and feedback. You use which method is okay by you. If you want to use process, impact, and outcome, you go for it. If you want to use any other one, you go for it. Sometimes we have medical educational program, we have, as the case may be, but there's need for us to evaluate and get feedback from our students. In conclusion, what have we learned in this speech? The fact remains that postgraduate education in HIM is essential for developing competent professionals who can navigate the complexity of health data management and contribute to improving healthcare outcomes through effective information systems. We're also concluding that while developed countries benefit from comprehensive curricula, advanced teaching methodologies, and robust research opportunities, we in the developing countries continue to face challenges that necessitate a more pragmatic approach to education. So we want to improve. We have learned that people coming up with our program, they are driven by demands. The demands in the market is making university to come up with our programs. Demands in the country is making government to put some support. And that's what is happening in the developed world. Addressing this disparity through collaborative efforts and resource allocation can actually enhance HIM education globally and Nigeria in particular, ultimately improving healthcare outcomes. I have a few recommendations for us to go home with, or what I will call take-home point. Number one is that there is need to foster a partnership between institutions in the developed countries too. If we have some in developing countries, fine. Our professional association have requested that if there is a way the university wants our cooperation, our partnership, we are willing to be part. Also, our curriculum should be tailored to include essential HIM competencies, like those skills that we need to get, continuous education, and while considering local healthcare needs too. So as we develop our curriculum, we also want to look at what is obtainable within our context. Also, there's need to increase investment in educational technology, IT, to support blended learning in HIM higher education or postgraduate education in HIM. Then universities, institutes, individuals, and government should also help to provide grants for funding opportunities to support HIM research in Nigeria. If we do all of this, we'll be able to go home with the following points. Number one, I want to conclude by saying that data is the new oil, but health information management is the refinery. You know, when there's surplus oil in the ground and there's no refinery to refine, it will be suffering. So within the health sector, for some of us who may be policymakers enjoying this program, please, we are the refinery to health data. Number two, in an age of information overload, effective management of health data is essential for better patient outcomes. So our colleagues should be allowed to be trained. Management should allow them for postgraduate studies. They should even sponsor continuous education should be sponsored by the management of our hospitals so that our people will be exposed to what they need to know. Postgraduate education in HIM empowers professionals to turn data into actionable insight. So if you don't have it, you cannot. And as healthcare evolves, those who manage information will lead the way to better health for all. And very lastly, the future of healthcare lies in our ability to leverage information. Let us explore how education in HIM make that possible. Thank you very much for this opportunity to speak.
Thank you very much. I think we should give him a standing ovation for this inspiring lecture. Thank you very much. Thank you very much. We'll appreciate. We can now resume our seats. Thank you very much. I must say that with what we have had now, we are going to tear up the current our current curriculum and then rebuild it with this information you have given to us. The good thing is that you are with us, and we can we pray that we will continue to avail us with your services. Thank you very much. Thank you very much. We are going to take a short break. Let's use the opportunity to stretch, and then but we are going to have some cultural displays. We are going to bring some cultural troops from River State to entertain us, and after that we will go into the next section, and that next section is on the panel discussion on the theme, and we have the four listed discussants. Let me also say, yes, Dr. Pele, you have to also help us with your slides to enable us share with our students. I'm sure that they will expect some questions from the slide in their next exams. Thank you very much, sir. So please, cultural display, and as we take a short a break, I know that our discussants are already with us. So in the next by 12:40, we'll reconvene for the panel discussion. 12:40. In 10 minutes, in 10 minutes time, we'll be reconvening for the panel discussion. Thank you.
all last Baba, Yara can dig Bravo, and when Manga for Bin. And go when younger for Biane. Idi Kuma. Egelegimane. Tumbena Semena. Kuruti. Kuma.
Is it after 10 minutes? Oh. Is it after 45? 3 minutes more. Okay, 3 minutes. Just play that the short film. Oh.
so that the
Okay, it's all right. We can. Okay, sorry. Let's just start. Let's just start. Can we go? Hello. Sorry. I think we can start the panel discussion. We have 4 panel discussants. Dr. Anthony Webo of the River State University, Dr. Sani Nasiru of the Nasarawa State University, Barrister Boniface Wani, former president of the Association of Health Records and Information Practitioners of Nigeria, and of course a trained lawyer called to bar, and then Mrs. Halima Haruna. Let's identify them. Let's make sure that they are present before we continue. Dr. Weber, are you there? Hello, sir. Hello, Anthony Weber. Is he? He's not there? Okay. Dr. Sani Nasiru. Hello, sir. Dr. Nasiru, sir. Sorry? Sorry, they are not. Okay. So, Barrister Wani, hello, sir. Hello, former president, ex-official 1. Hello, sir. Can you ensure it's online? Hello, sir. Barrister Wani. Okay. What of our madam? Mrs. Halima, sir. Ma, sorry.
Yes, sir. Yes, sir. Yes, sir.
Thank
Good
you.
afternoon, sir.
Thank you very much, ma. It's
Yes,
good to have you with us.
Yes, thank you.
Barrister Wani. Okay, that is fine. That is fine, sir. I think we can start with 2 of them. If Anthony Weber and Sani Nasiru, once they join, please inform me. Can I? Okay. Is that Wani? Who is trying to speak? Okay. They used to say ladies before gentlemen, and I know that they are all gentlemen, so we can start with madam. Usually, we want you to probably give your opening remark. You say something before we can go into the question and answer section. Hello, madam. You want something? You want to say something first? Yeah.
Yes, thanks for the opportunity and good afternoon. Permit me to maintain the already established protocol, sir. I'm Halim Ahmad Haruna, Assistant Director, Health Record Officers Registration Board of Nigeria. PhD in view, a student with the Rivers State University, and a year student by the grace of God. I must appreciate you, the management entirely, for this wonderful effort to come up with this timely conference. I call it timely because this is a very kind of period that we need it. We need it most because of the evolution in healthcare services. And we are the drivers of this evolutionary mission in healthcare services. So I must congratulate you. And before now, Uniport is a friend of the board. Uniport is a friend of the board. I must acknowledge that before the commencement of this postgraduate program in Uniport, there was physical contact. Series of physical meeting was held. Professor Best, today I must congratulate you and say thank you so very much for having us at heart for this wonderful effort in continuous strengthening of health information management practices in Nigeria today. We must appreciate you. Thank you so very much. And the anchor, I appreciate you too, as our friend honor to be part of this conference. As the board, we are wishing we're ready to work with the university. I must reiterate the comments, the speech made by our able registrar. And area of specialization is very, very key at this point in time, which, as I talked to you yesterday, there was a TMC meeting. At that TMC, he gave directive that we should harmonize all the contributions that was made by the stakeholders in the country so that we can also call the high-level manpower of academicians to the board to come and moderate this wonderful curriculum of specialization, which hopefully before the end of the year, this specialization curriculum will be ready. And I know that UNIPORT will be one of the first drivers to anchor this specialization program by the grace of God. So we are at the board, we are ready, well equipped to take advices and also your contributions in strengthening health information practices in Nigeria. So thank you so very much. And I must also say I appreciate you and I feel honored for being part of this wonderful first conference of the UNIPORT. Thank you so very much.
Thank you, Ma. Thank you, Ma. Thanks for that. You'll be assured that we will work more closely with the board now that we are making arrangements to start our undergraduate program. You know, we have to come and for resource verifications and all the other things. Thank you very much, Ma. Can we go to Barrister Wami? Hello, sir. We'll come to you again, Ma. But let's just go around and get the remarks of the others. Hello, Barrister Wami, sir. I hope you're still around. Okay, network issues. What of the others? Nasiru and Anthony Weber. Perhaps. Okay, Ma. It seems let's just probably continue with you since we are having problems with the others. Thank you very much. I'm sure that those subspecialties that you talked about, I'm sure that we'll get to know them because usually the PhD programs, PhDs are awarded in those subspecialties. So we want to even start immediately with those that were just admitted into our programs, so that we'll just insist that they have to choose a topic along that line. So thank you very much, Ma. I was just thinking, you have people that did training, not the traditional health information management education, like they had their degrees probably in computer science. Are there training programs that can get them, that they can enroll in to enable them become registered as licensed health information management practitioner professionals? Are there training programs?
Sir, let me respond to your questions. And I must be honest with you. At that level, we cannot admit such a candidate. We deal with those that have the background of health information knowledge. Being that at ND and HND, we examined them and we licensed them, which we were already sure that yes, this is our product and they are capable of handling the practices. For those that have computer science, the knowledge is only based on computer area. They don't have issues. They don't have knowledge that has to do with administrative issues that has to do with hospital management and patient data management. And that is why at this level, we cannot accept them. Thank you, sir.
Okay, sir. Okay, ma. So, okay, I thought I had something similar to that, something close to that. That if someone, because you know, the board is the regulatory board for all health information management professionals, and in some of the teaching hospitals, they are beginning to have to probably employ so-called data analysts to get involved, especially when they are migrating into the electronic health system, electronic health record system. I'm sure that you are aware of such persons. Is there any way to bring them into the fold?
Yes, sir.
By getting them, because they are actually being employed, should I say illegally, because you shouldn't be employed to carry out health information management responsibilities without the license of the board. Is there any way out of the problem?
Yes, sir. As far as the board is concerned, there's no any provision made for such people, and as far as the practice is concerned, they are quite irrespective of the level of their education. Since they are not licensed to practice, they are quacks, and we have the backing of the ministry and the minister himself that anybody, any institution in this country that is under their jurisdiction must employ a licensed health information manager. And that is why we are also equipping our curriculum to include data analytics as part of the core subject within the BHM jurisdiction, and also a specialization on that area too. Thank you, sir.
Okay, it's all right. I was just thinking that maybe there's an arrangement like chartered accountants. At times you need to they organize a training program that once you conclude, you can now sit for the exam, and if you pass, you can become a chartered accountant. I thought the board was looking into that possibility. Okay, it's all right.
That is not acceptable, sir. Thank you.
Okay. Anyway, for now, let me say. Okay, ma. The other thing has to do with yes. I'm sure that the board made contributions towards the CC marks of NUC. So like now we want to start our undergraduate programs. Are there steps we need to take to ensure that we don't run foul of the establishment process? Are there steps that you want to encourage us to take to ensure that
yes,
we have?
Yes, actually, in the period during the period of development of our CCMAS, the board and the professionals, including our senior stakeholder, were fully involved. The board took charge to make sure that the right thing is done. And even after this year, the NUC released the 75%, the board in its own wisdom also invited some of the high-level academicians also to the board, that we work together with them to also develop 25%, which were 5% was left for university peculiarity, and to ensure that enough package is given to the BHRM graduates. And also the process that is involved is this still the normal processes that every institution must be accredited, in that both the human resource and also the equipment that ought to be used for the training must be available and efficient for those students to learn comfortably. Thank you.
Okay, ma. So your accreditation, is it especially this initial period, is it done separately or jointly with NUC?
For now we are separate, and ours is the first visit is resource verification.
Okay.
And after the resource verification, we give the period of 6 months where we come for the main accreditation fully. For now, it's separate. But the NUC is working with us to see how we can harmonize it and work together. But that has not been achieved yet. For now, it's separate. Thank you, sir.
Okay. Thank you, ma. Okay. Finally, usually although we have our postgraduate programs leading to the award of those certificates, masters, as PhD, PhD, masters, and now PhD. Is it possible for the board to organize 1 or 2 short courses, especially those I've seen some softwares being made mandatory, for the students to be trained to have competencies in. I think that is usually managed by the board. Is there any possibility of the board of the board organizing such for students in our school? Yeah, because right now we may probably have 100 plus. So I just feel that perhaps we just look at the possibility of the board helping us with that, so that at the end of that, yes, at the end of that training, a certificate can be awarded jointly with us. Between the board and our university can jointly award the certificate, because we are also interested in the professional aspect, the competence, which you are also very interested in. Is it possible? And is there anyone that you can easily start work on, start making arrangement on? Usually we pay for the short courses for our students. But that is if it is not more than 20,000-30,000. But to be able to I hope we can have at least one that we can work on between now and
Sure. Yeah, the board is ready to organize such training, and also for the undergraduates also, as part of our requirements, it's a must that every training institution must have a HRM demonstration room, which is a complete replica of HRM department. A replica of Health Information Management Department of the hospital must be domiciled in that HRM demonstration room for the students to get acquainted to the practical procedure before they are exposed to the main hospitals. So the board has developed a software, an electronic software for the student practical experience before their exposure to the main hospital software. The board will be ready at any time to organize such training also for your students at hand.
That is wonderful. Like almost like a simulation. Yes. Where you just go and you have your experience without any problems. Thank you very much, ma. Thank you for the wonderful input. Thank you very much. You appear more friendly today.
I am friendly, sir. It's only during exam that I'm not friendly.
No, each time we spoke, I usually, each time I want to speak with you, palpitation, my heart will be beating faster than usual. But thank you. It's not like that.
Please be free,
sir. Not like that today. It's not like that today.
Because I'm a comrade. Maybe because I'm a comrade, that is why sometimes I might be hard on the phone, but I'm a very simple person, but highly principled, sir. Highly principled.
I know. You are not a politician at all. You shoot straight. You don't miss words. Thank you very much, ma.
It's my pleasure, sir. I appreciate, sir. Thanks for the opportunity. And good afternoon, sir. Good afternoon. Yeah.
Yes. So I don't know if me or any of those sorry. I got Tony. I got Weibo. Hello, sir. I hope your network is still in the state of emergency. Hello, I got Anthony. Is he? Can you unmute him? Hello, Anthony. One of the others. Hello, I got Barrister. Hello.
Good morning, Prof.
Yeah, good morning. Oh, okay. This Oga Webo.
Yes, sir.
Yeah, so welcome, sir. Welcome, sir. It could have been a very big loss.
A serious meeting.
No
so
problem.
I have to
No
attend that
problem.
meeting
You
first
are
and then join.
okay. Anyway, has it anything to do with resource control?
Okay.
Okay. It's wonderful. Very yes. You know, you have an interesting career. You are started health information management practitioner. You are a biostatistician, and you are currently the HOD, public health in the university. Can you just tell us how you are able to get to acquire these qualifications? Registered a health information management practitioner, biostatistics. I think biostatistics is you did your PhD in biostatistics, and now you are the HOD.
Yes,
HOD public health. Can you tell us? Just tell us about you. Or first of all, you have not given us your opening remarks. Can you just give us your opening remarks before the questions?
Okay, thank you, Prophet. Thank you, members of the panel. It's a rare privilege to speak to all of us this afternoon. First of all, I have to apologize for joining this late. The remark, I want to sincerely thank the School of Public Health for giving, most importantly, the health information professional the opportunity to advance their career. Okay, before we have just HND is our terminal qualification, but School of Public Health, University of Port Harcourt pioneered this advanced education by, putting in place a postgraduate program for PhD, MSc, and now we have a PhD. So, Prof. and your team, I must thank you and congratulate you for this opportunity for the profession to grow up to this point. So, having said that, I'm speaking today as not just as a health information officer or professional, but I'm also speaking as a university academic. And I have my basic qualification in mathematics statistics. Alongside, I have my technician qualification in health information management. And of course, that is where my journey into public health started. And God, it's health information that gave me the opportunity. They exposed me into the world of health research. And after then, I moved into MSc in medical statistics at University of Ibadan. As of then, they were the only university in Nigeria that offered the MSc in medical statistics. So I currently hold a PhD in applied statistics and biostatistics. As we speak today, as we're speaking, I'm the head of department of public health sciences, Riverside University, and I hold the chair and official professor of biostatistics and population epidemiology. Health information is indeed the gateway for healthcare services because it's the entry point of every person that seeks care in the health facility. And it means that every professional must be well skilled and knowledgeable. Otherwise, the care will not be adequately disseminated. And so they require the sound knowledge, sound skill, which is what School of Health Information, School of Public Health is intended or is providing for our teaming professionals. And so it wasn't actually a difficult thing. It all has to do with determination and sacrifice because you know what it means to move from one part of the country to the other part of the country in quest or in search for knowledge and qualification. So all these things are drive because we want to make the profession stronger, even more than the way we met it. And I'm proud to say today that this health information management in Nigeria have at least can comfortably compete with the counterpart in every other part of the country. And this is the world, I mean. And this is courtesy of organization like the School of Public Health, University of Port Harcourt. So having said this, I want to once again thank you, and then for giving me the opportunity to speak, and then make my contribution in making this conference a successful one. Thank you, Prof.
Thank you very much. You obviously are not afraid of mathematics. Do you think that, all practitioners of health information management should not be afraid of mathematics?
Because
in this case, yes, statistics.
Yeah, health information, when they started, we have the life of Master Nwaro, which is one of the fathers of health information in River State. We have somebody like Boga sitting by your side. Their qualification, which they got at University of Ibadan, is health record and biostatistics.
Okay, statistics.
What it means that health information and statistics, or even in particular biostatistics, are like brothers and sisters, because the information we are talking about is figure. And so every health information professional is expected to be figure friendly. So I don't think should be afraid of figure.
What kind of research do you think they should be carrying out? Must it? I think it has to do with robust statistical analysis to make it truly worthy of that degree, because the degree in master's degree means the mastery of health information management, and that should show in the thesis.
Yeah, health information, I think they should be more involved in quantitative research.
Quantitative.
Yes, quantitative research, because they have to do with the correlation of this. And we can see there are a lot of specialization that can be coined from the health information management. Like we talk about data science, we can even talk about the health statistics. We can even talk about health information and communication and others. So these are specializations that can actually be attached to health information management. So if those are some of the subspecialties that we can attach to that, it means that all research that we conducted in health information management are core in using figures, and it's purely this what I can tag quantitative research. So quantitative research, because it will applied not like statistics. Statistics can be applied in all fields of human endeavors, and so there is no discipline that doesn't make use of information. So if they make use of information in health information management research, should also cut across all the disciplines, because in as much as they use information and they are disciplines, so then health information is key.
It's good that you are saying it to the hearing of the participants, many of whom are students, so that when we are approving research topics, we have to make sure that and they are quantitative, and I'm sure that you also being that you the kind of data or the kind of measurement that should be carried out. What do you think?
I didn't get you, Prof.
No, what I'm saying,
I didn't get you, Prof.
Is yes, I'm sure that part of it will be the scale of measurements.
Yes.
Do we have to stretch that? Of course, those in the health information management should also understand the various scales of measurement.
Of course, basically, statistically speaking, we have 4 measurement scale. If we talk about measurement scale, we have 4 measurement scale: the nominal, the ordinal, the interval, and then the ratio scale. And if we talk about that, their research will be quantitative. quantitative research. It means it will fall on the realm of interval and ratio scale. But then the ratio scale, which have to be the chief of them all, can, whether it is nominal and ordinal, okay, can be stretched, okay, depending on the research objective. But the key here we are talking about is that is their qualitative research.
So we can assume that they will understand the various the characteristics of each of those skills to know when to stretch and when to constrict. Yes. Okay. Yeah. Thank you very much. You know, we are also getting insights on how to run this program, and it's also very good. I have acknowledged, I have done a disclaimer that of all the programs in the School of Public Health, is this program, Health Information Management, that I have the least knowledge. I can't come in, and which means that we depend almost entirely on people like you. Thank you very much, Oga Webo. Yes, I think, let me say, you have done us proud. You have done us proud. I now understand where that biostatistics came from. From Oga Wanro and people like you. Because I looked at the results and I didn't enjoy what I saw. And my people used to say that if you are finding it difficult to drink tea, is it over tea that you survive?
Absolutely.
Okay, thank you very much. Barrister, one is here around? Okay. Hello, Barrister. Hello, Barrister. Can you thank you very much, Webo. So we may come back to you, but let's see if we can get the comments of.
Good afternoon, sir.
Good day. Oh. Sorry, I think we have to apologize for your poor network. What we can manage. Can you give us the opening remarks? You know, we can't thank you enough for the support, moral support, and then the presidential support you gave to us. But can you give your opening remarks before we go into the question and answer section? Did you? Oh, network. Okay. Anyway, that is the one problem with this our format. What of Nasiru? Okay, it's all right. So can we, if our keynote speaker and then our chairman, if they are still around, they can give us their closing remarks to enable us close this section. The chairman, Dr. Umar Farouk, are you still around? Hello, sir. Can you unmute? Which of them? Or the keynote speaker, you know, the chairman should probably say be the last. Okay, Dr. Pele, can you give your remark, closing remark? Oh.
Hello.
He said,
no.
Doctor?
Yes, can I talk? Can I
okay, yes, yeah. Hello, Chairman.
Yes, sir. I must congratulate the keynote speaker for today, Associate Professor Jacob Opele, for a very wonderful presentation. And of course, the other panelists that have made a significant
significant contribution on today's presentation. Actually, what I want to add as far as postgraduate education in health information education, it has to do with such grant, so that if the postgraduate program attracted grants, therefore it will increase the quality of the education, because these research grants can also be attracted from the industry with specific needs, and they want students to and the lecturers to work on, and that will tie the program, to the practical needs which the today's lecture or presentation have, highlighted, because there's a gap between the theory and the practice. So if the postgraduate attracted a grant which is practical based, then it will fit in, fill in those gaps. Also, we need to also consider in today's learning, education is more of student-centered in teaching than teacher-centered. So we need to encourage students to really contribute in the classroom, and the classroom to be interactive. Actually, we must congratulate ourselves for having this level of development as far as postgraduate education in health information management is concerned. I remember sometime in 2013, when I wanted to go for MSc in health information management, the only one available was the one in Ibadan at that time, which was also a professional master. So I had to venture to went to UK and study MSc in Kingston University, London. And that was even before the BAPCO started. So now we can have up to about 15 universities offering BSc or degree in health information management. That's a good plus. And we have a number of them going in for master's degree. That's also another great improvement, and of course development as far as the profession is concerned. And now we also have PhDs coming up. So this needs to be sustained. And also regarding the areas of research, as I've mentioned earlier on, the research topics should not only be those on technologically based. For instance, the EHR concept of research, which we always argue that even up to this moment, we don't have standardized, electronic health records in this country. Therefore, people tend to become a little bit confused. And so also the research output may not be really, impactful. So we need to also develop our own traditional system of health record system, which have to do with the manual or a kind of paper-based, because we are still operating on the hybrid system. 90% of our hospitals still operate a hybrid system. So we should not allow those research areas like coding, like appointment systems, like waiting time, like filing system, like methods of medical correspondences, and of course central health records library need to be researched upon, so as also to improve the quality of healthcare, because of the overdependence of all these theses and postgraduate researches in technology, and with the technology is not well perfected because of what we know about the challenges of implementation of technology in our healthcare sector, which even some of it in the forefront, for instance, the electricity, high cost of internet, training of personnel. Even the Professor Benz have mentioned, the kind of, level of technical competence which some of us may be having, which may also have impact on the negative output of the research and of course of work. So we need to also concentrate on our traditional health record system to improve it. We all know that we operate on the hybrid system, and we all know that technology is not standardized as far as it's concerned. So our research should not only be centered on a kind of technology based. We also have to mix. We have to have a mix of, we have a lot of, we are sitting on a fountain of knowledge. We are sitting on a fountain of data and information that has been generated in the healthcare system. That's why even the presenter for today is also based bias in knowledge management. So this knowledge management is also there in our shelves, it's there in our files, it's there in our records in order, to preserve it, to conserve it, to preserve it, and to make it meaningful, to process it in such a way that they become lasting, and also to apply the health record cycle to create, to maintain, to use, and to dispose when necessary. So all these things need to be highlighted, not to be underscored. My name is Umar Farouk Abubakar. As you mentioned earlier on, I specialize in health information management and health informatics. Presently, I'm a reader in health informatics at the Federal University of Health Sciences, Azare, and on sabbatical at ICT Medical Institute, University of Medical Teaching Hospital. I appreciate you for the time, for the honor, and the privilege. Thank you very much, sir. Thank you for giving me the opportunity to grow. Thank you, sir.
Thank you. Thank you, Umar Farouk. He didn't tell us that you are now in Medugri. I hear Medugri is calm now.
Very calm, sir. Very calm, sir. Very calm. And social.
Sorry. Yes, it's calm.
Yeah.
Thank you very much, sir.
Thank you, sir.
That we don't need to pray for your safety. Thank you.
You keep praying. Nobody will say whether when there is safety, there should be more safety. I can see Saruk laughing, Dr. Saruk.
Thank you. Just as they wonder how we survive it in Port Harcourt, but Port Harcourt is calm. Thank you very much, sir. Thank you. Nagode. Nagode. Can we, Dr. Pele, is he there for his cousin? Okay, I think we can close. Let me thank just vote of thanks. I could have left it for our coordinator to do, but let me do it. Let me first of all thank God. I think this it turned out far better, far better than I thought, especially with the active participation of the board. I have to especially thank the registrar, Alhaji Baba Gana Mustafa. Thank you very much, and especially for that wonderful remark. In fact, we have recorded the remark, and we are going to act on every bit of it, including the subspecialties. I took notes, and I will immediately. In fact, that means that the topics we have already collected from our PhD students, we are going to cancel them with immediate effect. And we ask the students to resubmit. We ask the students to resubmit along the lines of those subspecialties. That is the way, probably that is the way to build competence. And for you to be awarded degree, PhD, you'll be awarded the PhD in that subspecialty. And you should read deeply into that subspecialty. But the good thing is that even in our school, we'll insist that you do a systematic review. So you will do a systematic review on that subspecialty. For giving us that insight, because I was just wondering, when each time I go to our graduate school, they will tell us that the PhDs are not awarded in broad fields, and we have had cause to rewrite certificates because of their insistence that the subspecialty must be included in that in the certificate. So we have to thank the registrar for that. I know. I think I probably will have to. I have to also convey the gratitude of our VC, our Vice Chancellor. He was shadowed to be present during this for today. He was shadowed to be present, but he was suddenly called by the minister to be part of the Nigerians delegation to UNGAS. He's currently in New York, attending the United Nations General Assembly. So, but he has sent his greetings and his gratitude for everything and for the collaboration with the board. Okay, thank you very much, the board. For the chairman of the occasion, our own should I, anyway, I'm free to say our own, Dr. Umar Farouk Abubakar, associate professor with the Federal University of Azare, and he just told us that he's in Medugri. You know, he is a pioneer. He's a pioneer, and one will not begrudge him if he goes about spreading his knowledge, because his knowledge is too much to be restricted to one university or one teaching hospital. So thank you very much, Dr. Umar Farouk Abubakar.
Thank you, sir.
Thank you very much, sir. I have to thank the keynote speaker. What a wonderful lecture. Although we didn't expect anything less from Dr. Jacob Kainde Opele. He truly showed to be a professor of knowledge management. He has truly showed that, a resource person, a consultant, a mentor. So in fact, let me say that, let me confess that he's even my mentor when it comes to running this program in health information management. He has mentored us all in University of Port Harcourt, yes, School of Public Health. Thank you very much for this lecture. Thank you, we appreciate. The panelists, we have to thank the lady amongst them, Mrs. Halima Ahmed Haruma. Thank you very much, ma, for the insights, and for the guidance. I know that if what I'm going to take home today is that I can call you without any panic. I can call you now without feeling that. I like the fact that you are straightforward. The only thing is that at times we want you to bend, but most times you refuse to bend. Thank you very much, man. We like that. We like much more of you, and we want you to guide us in our journey to commence the undergraduate program in our institution. Thank you very much. Then Dr. Anthony Weber is our own guy. He's our man now. Our man, Anthony Weber. Anytime, I know you are busy at the other side of town. Anytime you come to you come to this our side, please just tell me. I will take you to our staff club, for you to go and enjoy there. Thank you very much, Weber, for such an insight. Now I can tell this our students that you go and do analysis, so not to bring those qualitative things that they have been bringing to us. We will have to do, and I can quote you. So if they complain, they know who has created a problem for them. Thank you very much, Anthony. Then Boniface, I think Boniface Wani, it was network that caused it, but he joined early, and I must thank him for his efforts, especially during when we were about to start. He made everything possible, gave us all the encouragements. He gave us but he told us, they conveyed the impression that it will be easy. It will be easy to take off until we went to the board and met we met Alima. So they didn't tell us that we have a very iron lady there. But thank you very much, Oga Barrister. We had wanted to find out how you were able to combine the fact that you are a lawyer that is called to bar, and you are also your main job, your main work as a health information management professional. But network didn't allow us. Nasiru Sani Nasiru, I'm sure that is network. I'm sure that is not network. I think I must say that he is our external examiner. I don't know. I don't know if is the reason why he decided not to come, so that he will not be disqualified. No, this one is not. This one no count? This one no follow. It doesn't count. So thank you very much. But we have been relating with him, and we actually like the way he examines our students, passing on the information, passing on the necessary information. In fact, at times he turns the examination process into lecture. So thank you very much for your contribution. Distinguished guests, other officials of the board, we have to thank them personally. Personally and collectively, we thank you. We thank the president and the vice president, and of course, all the members of the association, I thank you. The River State chapter, the national, and everybody, we thank you. I will not cease in thanking those in the implementation committee. Ogada. Unfortunately, we didn't have enough time to make your remark. Maruche, Israel, Wanro, Shedrack, Webo, Bogba, Wosa, Pauline Okocha. We thank you all. In fact, when we are going to probably commission a plaque, and put it so that to immortalize their effort, especially as I begin to wind up my tenure as the director of the School of Public Health. Want to keep the records for posterity. So we are going to probably create a plaque to immortalize their efforts, since we cannot individually give you this award. Then, of course, my colleagues in the department, and then the lecturer, the coordinator, the lecturers and supervisors, our supervisors. I have mentioned them: Dr. Pele, Dr. Makata, Dr. Odwak, Barisa Weni, Dr. Adebayo, Umar Farouk, Adio Adetona, Shedrack, but not Mishak, Israel, Tunde Ayelegbe, Macaulay, Babafemi, Anyewe, Eze, and I must also say Liman. Liman Ilyasu Liman Kura. Wonderful guy. I'm sure that he sounds like a young man, but very, very passionate. Very, very passionate. He has been able to organize those in the north. He calls me multiple times. I say, Liman, I'm tired. But I like that. I like his passion. And I like his passion. Thank you very much, Liman. He told me that he will be traveling moving from one part of town to the other, and that he may not. But please send my gratitude, my appreciation to Liman. And then every other person, yes, every other person. So I have to thank you all for attending. Thank you all for attending, and then thank you all. So we can, and of course, every other person, students and colleagues, everybody, we thank you all. So we can now formally close, and we are going to close first with our university item, then the university item, then no, which one now? It's supposed to be the reverse order. So which one now? National item first, No, the university item and the national item. Thank you very much. So let's stand up for that.
On the green lowlands and swampy plains of the New Calabar River stands the University of Port Harcourt, a citadel of learning and excellent education. All of academic enthusiasts searching for knowledge and wisdom, enlightenment, and self-reliance on mission. Our hope in the future is rooted in God. The vision of our fathers shining in the stars, opportunities unlimited and equal. Our progeny citizens of the universe, profound and near, the pride of Uniport, because unique, Uniport, unique, Uniport, unique, Uniport, Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed.
Thank you very much. Thank you very much. So those of you in the university and the teacher hospital, we have a small refreshment. But those of you that are online, I'm sure that the refreshments you got from our inspiring lectures may be enough. Thank you very much. And we may have an evening section starting by 4 for abstract presentation. Thank you very much. Thank you very much. And thank you very much.
Thank you very much indeed.